hanya bila kita bergerak bersama.
Sebab saya yakin,
tanpa kamu,
kebakaran hutan akan terus ada.
tanpa kamu,
perempuan akan terus berhadapan dengan kekerasan.
Tanpa kamu,
Anak-anak Indonesia masih terus belajar tanpa lampu.
tanpa kamu,
Anak-anak Indonesia masih juga tidak mendapatkan gizi yang cukup.
dan tanpa kamu,
potensi anak muda menjadi pengangguran akan terus ada.
Tanpa kamu,
tujuan-tujuan kita itu hanyalah mimpi belaka.
Jadi,
mari kita berjalan beriringan.
Mari kita berjalan beriringan.
Mewujudkan cita-cita kita bersama.
mewujudkan cita-cita kita bersama.
dan pastikan tak ada satupun kawan kita yang tertinggal di belakang.
17 tujuan untuk mengubah Indonesia yang lebih baik. Mari kita bangun Indonesia bersama-sama.
Apa sih yang kita inginkan untuk masa depan?
Keluarga yang sehat,
Pendidikan yang merata,
Akses untuk air bersih,
Ekonomi yang kuat.
atau lingkungan yang terawat.
semua itu adalah
Cita-cita kita bersama.
Melalui Sustainable Development Goals atau SDGs.
negara-negara termasuk Indonesia
telah turut serta dalam mewujudkan tujuan bersama tersebut.
Indonesia sendiri sudah membuat banyak pencapaian seperti
Tingkat kemiskinan yang terus berkurang,
akses pelayanan publik yang semakin baik,
Pendidikan dasar yang semakin tercukupi.
dan tingkat literasi nasional yang tinggi.
Akan tetapi, kita tidak boleh lengah.
sebab masih banyak tantangan yang menghadang di depan mata.
ketimpangan sosial masih
Ketimpangan
sangat
sosial yang masih sangat terasa,
Kebakaran dan kerusakan hutan.
kebakaran dan kerusakan hutan,
Kekerasan terhadap perempuan,
Kekerasan terhadap perempuan.
sampah plastik yang
sampah
merusak
plastik
lingkungan,
yang merusak lingkungan,
Pengangguran anak muda yang masih
pengangguran
tinggi.
anak muda yang masih tinggi.
pekerjaan-pekerjaan yang belum usai ini harus segera kita tuntaskan.
semua tantangan ini bisa kita taklukkan.
Hanya bila kita bergerak bersama.
Sebab saya yakin,
tanpa kamu,
Kebakaran hutan akan terus ada.
tanpa kamu,
Perempuan akan terus berhadapan dengan kekerasan.
Tanpa kamu,
Anak-anak Indonesia masih terus belajar tanpa lampu.
tanpa kamu,
Anak-anak Indonesia masih juga tidak mendapatkan gizi yang cukup.
dan tanpa kamu,
potensi anak muda menjadi pengangguran akan terus ada.
Tanpa kamu,
tujuan-tujuan kita itu hanyalah mimpi belaka.
Jadi,
mari kita berjalan beriringan.
Mari kita berjalan beriringan.
Mewujudkan cita-cita kita bersama.
mewujudkan cita-cita kita bersama.
dan pastikan tak ada satupun kawan kita yang tertinggal di belakang.
17 tujuan untuk mengubah Indonesia yang lebih baik. Mari kita bangun Indonesia bersama-sama.
Selamat siang dan salam sejahtera untuk kita sekalian. Kami ucapkan selamat datang kepada Wakil Gubernur Provinsi Gorontalo, kepada para pemateri, kepada expert kita, dan teristimewa kepada seluruh peserta webinar internasional pada siang hari ini. Ya, dan Fauzia, ya, sebelum kita akan memulai pelaksanaan webinar pada hari ini, kita akan membacakan tata tertib pelaksanaan webinar internasional.
Baik, yang pertama, peserta diharapkan hadir 15 menit sebelum dimulainya webinar.
Selanjutnya, seluruh peserta diwajibkan mengaktifkan kamera dan menonaktifkan suara saat webinar internasional berlangsung.
Dan yang ketiga, mengganti nama profil Zoom meeting dengan format nomor peserta, institusi, dan nama. Contohnya, 015 Fakultas Ekonomi Bisnis Alex Idrux.
Ya, dan selanjutnya, operator tidak akan admit atau menerima nama profil yang tidak menggunakan format yang telah ditentukan oleh panitia.
Pertanyaan kepada pemateri hanya dapat dilakukan melalui fitur chat di Zoom meeting.
Dan selanjutnya, selain pertanyaan, dilarang mengirim pesan apapun pada fitur chat to everyone.
Dan yang terakhir, Peserta yang akan diberikan sertifikat adalah peserta yang mengisi daftar hadir dan umpan balik di link yang akan di-share di akhir acara.
Ya, itulah dia tata tertib untuk pelaksanaan webinar internasional pada siang hari ini. Baiklah Fauzia, ya kita akan segera mulai. Assalamualaikum warahmatullahi wabarakatuh. Selamat siang hadirin Bapak dan Ibu peserta webinar internasional. Perkenalkan nama saya Fauzi.
Dan saya Fauzia.
Sebagai pemandu acara untuk kegiatan istimewa pada hari ini.
Good afternoon, ladies and gentlemen. My name is Fauzia.
And my name is Fauzi.
As the master of ceremony in this special occasion.
Welcome to the third International Interdisciplinary Conference on Sustainable Development Goals.
With the theme, Innovation to Empower Rural in the Time of COVID-19.
Yang diselenggarakan oleh Universitas Bina Mandiri dan Setia Stitek Bina Taruna Gorontalo.
Brought to you by Bina Mandiri University and Setia Stitek Bina Taruna Gorontalo.
Ya, dan Fauzia, kita patut berbangga ya karena hari ini merupakan tahun ketiga penyelenggaraan ICC SDGs untuk Gorontalo ya.
Walaupun mekanismenya agak sedikit berbeda ya Fauzi, dikarenakan pandemi COVID yang sementara mewabah sampai saat ini.
Iya benar banget, tapi tidak mengurangi antusias ya dan juga semangat para peserta webinar kita pada siang hari ini. Baik Fauzia, Bapak Ibu hadirin peserta seminar internasional webinar hari ini diselenggarakan untuk menjembatani terciptanya dialog dan kajian ilmiah yang komprehensif dalam mengkaji permasalahan dalam mengembangkan hasil riset inovatif dalam 5 bidang Fauzia ya. Di antaranya ada kebijakan publik, ada kesehatan, pendidikan, ekonomi, pembangunan, serta teknologi di tengah pandemi COVID-19.
So, ladies and gentlemen, this webinar aims to encourage the comprehensive discussion and scientific studies to develop the results of research innovation in 5 fields, which are public policy, health, education, economic and development, and the last is technology in this COVID-19 pandemic.
Ya, dan Fauzia tentunya kita patut bangga juga karena webinar internasional pada hari ini kita telah mendapatkan dukungan dari berbagai pihak. Di antaranya ada pemerintah Provinsi Gorontalo,
lalu ada APTISI Gorontalo,
AP Vokasi Gorontalo,
Academic International Consortium of Indonesia,
ada TII UPS International,
dan yang terakhir ada PUM Netherlands Senior Expert. Cukup banyak ya dukungan yang kita dapatkan di webinar hari ini.
Yeah. Benar banget, tak lupa kita ucapkan terima kasih. Dan hadirin, ya webinar internasional, pertama-tama mari kita panjatkan puji syukur kepada Allah Subhanahu wa Ta'ala yang telah memberikan kita bimbingan, kebahagiaan, kesehatan, dan rahmat sehingga dapat hadir dan berpartisipasi dalam acara yang istimewa ini. Tak lupa puji dan salam atas Nabi kita Muhammad SAW yang telah membawa kita ke jalan yang terang dari kegelapan dalam hidup ini.
Ladies and gentlemen, first of all, let's thank to God, the Almighty, who giving us grace and blessings so we can attend in this precious event. Praise and greetings to our Prophet Muhammad SAW, who has led us to the path of light from the darkness in this life.
Ya, Fauzia, Bapak Ibu hadirin webinar internasional pada siang hari ini, izinkan kami untuk menyapa tamu kehormatan dan pemateri kita pada siang hari ini.
Yeah, ladies and gentlemen, let us introduce the honorable guests and speakers for today's event.
Yang terhormat Wakil Gubernur Gorontalo, Bapak Dr. Andus Haji Idris Rahim MM.
The Honorable Vice Governor of Gorontalo Province, Dr. Andus Haji Idris Rahim MM.
Yang kami hormati Kepala LLDikti Wilayah 16 Gorontalo, Sulawesi Tengah, Sulawesi Utara, Bapak Profesor Dr. Insinyur Mahludin Barwadi MP.
The Honorable Head of LLDikti Region 16 Gorontalo, Central Syllabus and North Syllabus, Profesor Dr. Insinyur Mahludin Barwadi MP.
Yang kami hormati pimpinan perguruan tinggi swasta dan negeri se-Provinsi Gorontalo.
The Honorable Entrepreneur and founder of Indonesian One Kecamatan One Center OKOC from Indonesia, Dr. Sandiaga Uno, BBA, MBA.
The Honorable Philologist and member of World Health Organization and Advisory Board from Germany, Professor Dr. Albert Osterhaus.
The Honorable Professor and Head Department of Public Health State from University of Bangladesh, Professor Dr. Nauzia Yasmin.
And next, the Honorable Pioneer in Fleet Learning and Cloud Computing from United Kingdom, Tim Baker.
The Honorable Bioenergy Research and Professor from National Chongqing University from Taiwan, Kang Tongwu, PhD.
And the Honorable PhD in Rural Development Professor and Field Studies from Pangasinan State University of the Philippines, Dr. Kristeta Sidulos.
Dan kepada seluruh partisipan webinar internasional hari ini.
Ya, cukup banyak peserta ya, karena berinformasi sudah melebihi angka 1000 ya. Dan ini kita sangat berbangga tentunya, antusias dari peserta sudah melebihi angka 1000. Ya, hadirin, Bapak Ibu peserta webinar internasional, dan Fauzia, mari sama-sama kita buka acara pada siang hari ini dengan membacakan basmalah.
Yeah, that's right, Fauzi. Ladies and gentlemen, let's begin this event with basmalah.
Bismillahirrahmanirrahim. Diawali dengan menyanyikan lagu Indonesia Raya, hadirin dimohon berdiri.
Ladies and gentlemen, please take a moment to sing the national anthem Indonesia Raya.
Hadirin dimohon duduk kembali. Dilanjutkan dengan pembacaan doa oleh Bapak William Mauduto.
The next agenda is the prayer reading, which will be led by Mr. William Mauduto. Mr. William, the floor is yours.
Ya, nampaknya kita sementara menunggu ya untuk terhubung dengan Bapak William Mauduto ya. Untuk panitia, mohon informasinya. Ya, masih sementara menghubungkan ya. Ya, masih sementara menghubungkan ya. Jadi sambil menunggu Bapak William Mauduto, kita berbincang-bincang dulu ya. Jadi tadi pagi ini ya untuk Fauzia telah dilaksanakan proceeding ya untuk kelima bidang kajian untuk SDGs untuk tahun ini ya. Jadi tadi pagi dari jam 8 waktu Indonesia bagian tengah ya telah dilaksanakan proceeding atau oral presentation oleh beberapa presenter. Dan juga telah berakhir tadi jam 11 siang waktu Indonesia bagian tengah. Oke, untuk Bapak William, monitor, apakah telah terhubung? Iya, Bapak William. Oke, masih belum nampaknya ya. Jadi kita masih menunggu lagi. Oke, kita masih menunggu lagi untuk terhubung ya dengan Bapak William Mooduto. Ya, mohon informasi apakah sudah terhubung? Monitor Pak William. Ya, nampaknya masih belum ya. Oke, tadi juga saya melihat antusias ya dari presenter yang memaparkan materinya itu sangat bersemangat ya tentunya. Oke, sudah terhubung ya dengan Pak William. Oke, dipersilakan Bapak William.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam 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 warahmatullahi wabarakatuh.
Warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Masih akan terus menunggu ya Fauzia. Oke, Fauzia, nantinya juga kita sebentar ya akan menampilkan virtual UMKM. Nah, baru dengar kan UMKM virtual?
Exhibition.
Benar banget ya, dan ini mungkin baru pertama di Gorontalo ya.
Terobosan baru di masa pandemi COVID ini ya.
Benar sekali, nantinya yang penasaran ingin melihat produk-produk UMKM di Gorontalo yang terus berinovasi di masa pandemi seperti ini, jangan lewatkan ya. Sebentar ya, nanti akan ada surprise UMKM apa saja yang terus berproduksi ya untuk menghasilkan produk terbaik di masa pandemi COVID-19.
Iya, benar sekali Fauzi.
Oke, kita masih menunggu ya untuk terhubung kembali ya dengan Bapak William Mooduto. Ya, apakah Bapak William masih sementara terhubung? Oke, masih sementara diusahakan ya. Nampaknya jaringan ini tidak bersahabat di Gorontalo ya. Waduh, iya. Karena mungkin tadi para ekspor kita sudah sudah mengisi proceeding ya, kemudian juga panitia lain ya di proceeding tadi saya lihat antusias juga banyak ya yang menghadirkan beberapa audiens dari perguruan tinggi yang ada di Gorontalo. Oke, untuk Pak William.
Ya.
Ya, silakan Bapak William.
Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Salatu wassalamu ala mursalin sayyidina Muhammadin wa ala alihi washabihi ajmain. Dengan nama Allah yang Maha Pengasih dan Maha Penyayang, segala puji dan syukur kami panjatkan kehadirat-Nya. Karena hanya kepada Engkau satu-satunya kami memanjatkan doa, memohon dan menyampaikan harapan. Ya Allah, ya Tuhan kami, acara seminar internasional Sustainable Development Goals. Dengan sifat Rahman dan Rahim-Mu, semoga seminar ini menjadi seminar yang Engkau ridhoi. Semoga seminar ini merupakan seminar yang Engkau berkahi, sehingga bermanfaat bagi masyarakat luas, khususnya masyarakat Gorontalo. Ya Allah, ya Tuhan yang Maha Pemberi petunjuk, berikanlah kepada kita semua. Ya Allah yang Maha Alim, berikan ilmu pengetahuan. Ya Allah, Tuhan yang Maha Mulia, hindarkanlah kami dari kehidupan hina-hina. Hindarkanlah kami dari kebodohan dan kemalasan dalam pengabdian kami. Jadikanlah kami generasi-generasi bangsa yang madani. Ya Allah, Tuhan yang Maha Suci, yang Maha Pengampun, sucikanlah kami dari dosa-dosa baik yang sengaja maupun yang tidak sengaja. Ampunilah dosa dan kesilapan orang tua kami, para guru kami, para pembimbing kami. Kabulkan doa dan permohonan kami, ya Allah. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Ya, demikianlah pembacaan doa oleh Bapak William Oduto, dan semoga doa-doa kita di siang hari ini akan dijabah oleh Allah Subhanahu wa taala. Baik Fauzia, Bapak Ibu hadirin peserta webinar internasional, selanjutnya kita akan melangkah pada laporan panitia oleh Bapak Imam Mashudi SPD MPD.
Okay, so for the next agenda is we are going to listen to the report speech by Mr. Iman Mashudi, SPD, MPD. Mr. Iman, the floor is yours.
Ya, terima kasih. Monitor, kedengaran suara?
Iya, bisa Pak, disilakan.
Oke, alhamdulillah. Baik, yang terhormat Bapak Wakil Gubernur Gorontalo, Bapak Dr. Andes Haji Idris Rahim MM, yang kami hormati Kepala Lembaga Layanan Pendidikan Tinggi Wilayah 16 Gorontalo, Sulut dan Sulteng, Bapak Profesor Dr. Insinyur Mahludin Baruadi MP, yang alhamdulillah hari ini hadir, ada perwakilan juga. Terima kasih Bapak. Yang kami hormati Kepala Aptisi Provinsi Gorontalo, Bapak Dr. Haji Muhammad Isman Yusuf SPS. Yang kami hormati Ketua Yayasan Bina Mandiri Gorontalo, Bapak Dr. Insinyur Haji Ajis Rahman MM, yang kami hormati Sekretaris Yayasan Bina Taruna Gorontalo, Ibu Dr. Haja Elis Rahman SOS MSI. Yang kami banggakan juga Ibu Rektor Universitas Bina Mandiri Gorontalo, Direktur Pasca Sarjana Setia Bina Taruna Gorontalo, Ketua Setia Bina Taruna Gorontalo, Ketua Stitek Bina Taruna Gorontalo, yang kami banggakan seluruh pimpinan perguruan tinggi negeri maupun swasta yang alhamdulillah hari ini berkenan hadir, ya, ada beberapa yang hadir ya dalam seminar atau webinar internasional yang insya Allah kita akan ikuti hingga selesai nanti. Tak lupa yang kami banggakan para pemateri peserta webinar internasional tahun 2020 yang dalam hal ini sudah berjumlah hampir mencapai sudah 840 ya, karena insya Allah ini akan terus bertambah karena di antrian masih cukup panjang ya mengantri. Baik, Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, salam sejahtera untuk kita semua. Om Swastiastu, Namo Buddhaya. Puji syukur atas kehadirat Allah Subhanahu wa taala, berkat limpahan rahmat, nikmat yang tak terhingga, sehingga pada hari ini kita berjumpa dalam ruang virtual ya dalam rangkaian seminar internasional. Salawat serta salam tak lupa kita haturkan kepada junjungan Nabi besar kita, Nabi Muhammad Sallallahu Alaihi Wasallam. Insya Allah curahan rahmat beliau sampai kepada kita semua yang masih istiqomah menjalankan sunnah-sunnahnya. Bapak Wakil Gubernur, tamu undangan, para pemateri, serta peserta webinar internasional yang saya hormati. Izinkan saya pada kesempatan ini akan menyampaikan laporan Ketua Panitia. Bapak Ibu yang saya hormati, tahun 2020 ini adalah tahun ketiga, seperti yang disampaikan oleh MC tadi di awal penyampaian, ya, yang telah kami laksanakan secara konsisten Bapak Ibu sekalian, ya, dengan mengangkat isu besar, yaitu tentang Sustainable Development Goals atau SDGs. Khususnya untuk tahun ini, kami mengangkat sebuah tema unik, ya, karena kondisi sekarang kita yang sedang diperhadapkan dengan pandemi COVID-19, sehingga kita mengangkat sebuah tema yang cukup menarik, yaitu pemberdayaan daerah melalui inovasi di tengah COVID-19. Sehingga alhamdulillah di tengah-tengah kita pada hari ini hadir Pak Wakil Gubernur yang nanti akan memberikan penguatan kepada kita semua terkait dengan program, terkait dengan kebijakan-kebijakannya. Penyelenggaraan seminar internasional tahun ini sangatlah berbeda, ya, seperti tidak sama dengan tahun-tahun yang sudah kita laksanakan, yaitu tahun 2018 dan 2019 kemarin. Hal ini disebabkan karena pada tahun ini, Bapak Ibu sekalian, kita menyelenggarakan secara virtual, Zoom Cloud Meeting, karena kita berada di tengah-tengah pandemi COVID-19. Meskipun demikian, kami sangat berharap makna kegiatan dan proses transfer keilmuan melalui mimbar akademik hari ini tidak akan berbeda kualitasnya dengan tahun-tahun sebelumnya. Itu yang kami berharap, sehingga semua peserta kami sangat berharap bisa mengikuti proses penyampaian informasi keilmuan oleh para pemateri-pemateri hebat yang kita sudah mintakan kesediaan untuk bisa diambil hikmahnya, keilmuannya untuk bisa diterapkan bersama-sama. Bapak Ibu yang saya hormati, webinar ini diselenggarakan berkolaborasi ya dengan beberapa perguruan tinggi swasta di Provinsi Gorontalo. Yang pertama adalah Universitas Bina Mandiri Gorontalo, Setia Bina Taruna Gorontalo, Stitek Bina Taruna Gorontalo, dan program Pasca Sarjana Setia Bina Taruna Gorontalo. Serta didukung oleh berbagai macam pihak, pemerintah Provinsi Gorontalo, LL Dikti Wilayah 16, Gorontalo, Sulut, dan Sulteng, Aptisi Provinsi Gorontalo, serta berbagai macam pihak yang tadi sudah disampaikan oleh MC. Ya, dan cukup besar saya kira harapan berbagai macam pihak agar kelancaran kegiatan ini bisa terlaksana dengan baik. Webinar internasional ini, seperti yang disampaikan oleh MC sebelumnya, kita melaksanakan 2 sesi. Sesi pertama kita sudah lakukan di pagi hari tadi, dan sesi kedua adalah hari ini, atau siang ini. Sesi pagi kita melaksanakan oral presentasi untuk luaran proceeding yang mencakup 5 subtopik. Yang pertama adalah kebijakan publik, ekonomi dan UMKM, pendidikan, kesehatan, lingkungan, dan teknologi. Alhamdulillah, tadi sudah berjalan dengan sangat baik, yang diikuti oleh 28 peserta yang terdiri dari berbagai wilayah. Ada yang dari Pulau Sumatera, Pulau Jawa, dan Gorontalo. Dan kami sangat apresiasi, terima kasih paling utama karena sudah melakukan proses tersebut. Dan itu sudah berjalan dengan sangat baik. Sesi siang ini adalah pelaksanaan webinar internasional yang merupakan puncak kegiatan kita. Dengan bangga, saya ingin memperkenalkan para pemateri kami. Yang pertama adalah Profesor Dr. Albert Osterhaus. Beliau ini dari Jerman dan beliau adalah perwakilan dari WHO. Sangat banyak saya kira dengan kondisi COVID saat ini akan banyak informasi-informasi menarik yang akan beliau sampaikan. Yang kedua, Bapak Dr. Sandiaga Uno, BBA, MBA. Beliau kita tahu bersama seorang entrepreneur sukses, tidak hanya memiliki usaha dalam negeri, tapi memiliki usaha di luar negeri. Akan tetapi Bapak Ibu sekalian, beliau mungkin pada kesempatan ini berhalangan hadir. Namun jangan khawatir, akan ada materi yang akan disampaikan dalam bentuk video oleh Bapak Sandiaga. Dan insya Allah ini juga akan memberikan semangat buat teman-teman UMKM yang juga hari ini bergabung bersama-sama. Yang ketiga, Jim Baker yang dari Inggris. Beliau juga nanti akan memberikan informasi yang saya kira tidak kalah penting dan sangat menarik skala internasional. Yang keempat, dari Taiwan, yaitu Keng Tungwu, PhD. Ya. Yang kelima adalah Dr. Kristeta Dulos dari Filipina. Bapak Ibu sekalian, untuk peserta sendiri seminar internasional yang terdata di panitia hingga pagi tadi, ya, yaitu sudah sejumlah 1.015 peserta yang terdiri dari berbagai kalangan, yaitu mahasiswa, dosen, praktisi, pegawai swasta dan pegawai negeri, serta pelaku UMKM. Dan ini kami sangat apresiasi, terima kasih banyak, dan ini merupakan bentuk sebuah penghargaan untuk kami. Ternyata walaupun kondisi pandemi, mencari ilmu bukanlah halangan. Untuk mengakhiri laporan panitia ini, ada beberapa hal yang ingin saya sampaikan. Yang pertama, atas nama panitia, kami ingin ucapkan terima kasih banyak dalam apresiasi dan dukungan dari berbagai pihak, yaitu beberapa perguruan tinggi, diantaranya adalah UBMG, Setia Bina Taruna Gorontalo, Stitek Bina Taruna, Program Pasca Sarjana Setia Bina Taruna, serta CCLC Bina Taruna, CCLC Bina Mandiri Gorontalo. Sebagai inisiator dan pihak yang berkolaborasi, sehingga alhamdulillah hari ini webinar internasional bisa kita laksanakan tahun 2020. Tak lupa kami ingin ucapkan terima kasih juga kepada Bapak Wakil Gubernur Gorontalo, Bapak Ibu tamu undangan, para pemateri, peserta serta semua pihak yang terlibat, baik secara langsung maupun tidak langsung, dalam mensukseskan kegiatan ini, yang mohon maaf Bapak Ibu sekalian, kami tidak bisa sebutkan satu persatu. Selanjutnya, pada kesempatan ini juga kami memohon kiranya Bapak Wakil Gubernur Gorontalo berkenan agar dapat memberikan sambutan sekaligus membuka kegiatan webinar internasional ini secara resmi. Akhirnya Bapak Ibu sekalian, apabila dalam rangkaian pelaksanaan webinar internasional hari ini, dimulai dari tadi pagi hingga siang hari ini, ada hal-hal yang kurang berkenan di hati Bapak Ibu sekalian, kami atas nama panitia memohonkan maaf sebesar-besarnya. Semoga tali silaturahim kita ke depan ini bisa terlaksana dan Bapak Ibu sekalian menunggu proses-proses atau kegiatan-kegiatan seminar-seminar kita ke depan. Sekian, billahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Iya, demikianlah tadi penyampaian laporan panitia dari Ketua Panitia Bapak Imam Hudi SPD MPD. Ya, inilah fokusnya Bapak Ibu hadirin peserta webinar internasional. Selanjutnya kita akan masuk pada acara sambutan. Sambutan oleh Wakil Gubernur Provinsi Gorontalo sekaligus akan membuka acara dengan resmi. Untuk itu kami undang dengan hormat kesediaan dari yang terhormat Bapak Dr. Andes Haji Idris Rahim MM.
Ladies and gentlemen, we are now going to listen to the opening speech by the Vice Governor of Gorontalo Province, Dr. Andes Haji Idris Rahim MM.
Wabarakatuh. Salam sejahtera bagi kita sekalian. Yang saya hormati Bapak Kepala L2 Dikti 16 Sulawesi Utara, Sulawesi Tengah, dan Gorontalo. Yang saya hormati Ketua Yayasan Universitas Bina Mandiri. Yang saya hormati Ketua Aptisi Provinsi Gorontalo. Yang saya hormati Rektor Universitas Bina Mandiri Gorontalo. Yang saya hormati pimpinan perguruan tinggi negeri dan swasta. Yang saya hormati Bapak Ibu narasumber baik dalam negeri maupun luar negeri, peserta webinar yang saya hormati dan banggakan. Pertama-tama, saya mengucapkan terima kasih kepada panitia pelaksana yang memberikan kehormatan pada saya untuk memberikan sambutan sekaligus membuka acara seminar internasional Sustainable Development Goals yang mengangkat tema Innovation to Empower Rural Communities in the Time of COVID-19. Pada kesempatan ini, saya tentunya apresiasi kepada Universitas Bina Mandiri yang ketiga kalinya melaksanakan seminar internasional yang berkolaborasi dengan berbagai perguruan tinggi lainnya di Gorontalo. Sustainable Development Goals atau tujuan pembangunan berkelanjutan adalah menyeimbangkan lingkungan, sosial, dan ekonomi yang meliputi 17 tujuan dengan 169 capaian sejak tahun 2015 diterbitkan hingga tahun 2030 yang merupakan ambisi bersama oleh negara-negara lintas pemerintahan. seminar internasional berfungsi sebagai salah satu upaya aksi nyata untuk mencapai tujuan agar tercapai komitmen yang kuat dari pemerintah pusat dan pemerintah daerah, serta akademisi, LSM, swasta, serta pemangku kepentingan lainnya. Bentuk komitmen pemerintah tersebut adalah adanya Peraturan Presiden Nomor 59 Tahun 2017 tentang pelaksanaan tujuan pembangunan berkelanjutan yang merupakan landasan hukum dan untuk Provinsi Gorontalo telah ditindaklanjuti dengan rencana aksi daerah tujuan pembangunan berkelanjutan dengan Peraturan Gubernur Gorontalo Nomor 66 Tahun 2018. Diharapkan SDGs atau tujuan pembangunan berkelanjutan yang ditetapkan PBB dapat tercapai 80-90%, mengingat 94 indikator global dalam SDGs telah sesuai dengan RPJMN 2015-2019. Namun dengan adanya pandemi COVID-19, tentunya terdapat perubahan-perubahan yang signifikan karena telah mempengaruhi semua sektor kehidupan. Utamanya pertumbuhan ekonomi kita di Provinsi Gorontalo triwulan 2 ini negatif 2,97%, sedangkan triwulan 3 itu negatif 0,07%. Begitu juga dengan transportasi, hotel, restoran, tempat-tempat wisata, pengangguran, dan juga pendapatan masyarakat pada umumnya punya dampak karena COVID-19. Dengan adanya pandemi COVID-19, pemerintah telah melakukan refocusing, realokasi anggaran, baik itu APBN, APBD, untuk kepentingan penyediaan sarana dan prasarana kesehatan, jaring pengaman sosial, dan juga stimulus ekonomi utamanya untuk UMKM. Salah satu inovasi kami di Provinsi Gorontalo dalam penyaluran bantuan ke masyarakat dalam bentuk jaring pengaman sosial agar tepat sasaran diperlukan keakuratan data. Oleh karenanya, kami baru-baru ini telah melaunching aplikasi elektronik jaring pengaman sosial yang merupakan perpaduan data dari DTKS, data terpadu kesejahteraan sosial dari Kemensos, dengan data Dukcapil dan juga data dari BPS. Tujuannya adalah agar angka kemiskinan menurun dan rakyat bisa berdaya. Sekali lagi terima kasih. Demikian sambutan singkat saya pada kesempatan sore hari ini. Sekian dan terima kasih, dan atas seizin Bapak Ibu sekalian, dengan mengucapkan Bismillahirrahmanirrahim, seminar internasional Interdisciplnary Conference on Sustainable Development Goals yang dilaksanakan oleh Universitas Bina Mandiri, saya buka dengan resmi. Wallahu musta'an. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Ya, demikianlah tadi sambutan oleh Wakil Gubernur Provinsi Gorontalo, Dan juga alhamdulillah ya telah membuka acara webinar internasional dengan resmi. Kami ucapkan terima kasih kepada Bapak. Ya, Fauzia. Nah, selanjutnya ini kita akan sama-sama mengikuti pemberian materi. Ya, materi pertama dari keynote speaker kita, Bapak Dr. Sandiaga Uno, selaku entrepreneur and founder of Indonesia One Kecamatan One Center, OKOC, dan akan juga Fauzia. Nah, ini tadi ya, dengan pameran virtual UMKM di Gorontalo, yang dimana terus berinovasi tengah pandemi COVID-19.
Yeah, that's right, Fauzi. Ladies and gentlemen, for the next agenda, we are going to listen to the keynote speech by founder of Indonesian One Kecamatan One Center, OKOC, Dr. Sandiaga Uno, as well as virtual exhibition of the UMKM entrepreneur or micro, small, and medium enterprise from Gorontalo province.
Terima kasih untuk Universitas Bina Mandiri Gorontalo bersama Setia Bina Taruna Gorontalo yang telah mengundang saya pada acara Third International Interdisciplinary Conference on SDGs. Tema Innovations to Empower Rural in the Time of COVID-19 sangatlah relevan, dan topik yaitu Entrepreneurial Innovations to Boost Economic Resilience through Pandemic adalah hal yang sangat strategis dan sangat krusial, khususnya di tengah pandemi dan melambatnya ekonomi. Syukur kehadirat Allah Subhanahu wa Ta'ala bahwa Gorontalo dan semua komponen masyarakat Gorontalo, baik di Provinsi Gorontalo maupun di luar Provinsi Gorontalo, masih terus dijaga oleh Allah Subhanahu wa Ta'ala sisi kesehatan dan mudah-mudahan tidak terdampak COVID-19. Millennials di tahun 2020 ada 83 juta jiwa di Indonesia, 34% dari total populasi. 1 dari 3 penduduk Indonesia adalah milenial. UTI dan NOU penting banget perannya. Jadi ini UTI dan NOU nih ya. UTI, Universitas Bina Mandiri Gorontalo bersama Setia Bina Taruna Gorontalo digerakkan lokomotifnya oleh UTI dan NOU yang perannya sungguh sangat strategis. Tulang punggung ekonomi Indonesia, maka harus tersedianya lapangan kerja. Mari kita buka lapangan kerja dengan entrepreneurship. Dengan entrepreneurial innovations kita bisa menggerakkan roda ekonomi, membuka lapangan kerja, mengambil peluang. Dan saya yakin jika kita jujur bahwa sekaranglah cari kerja itu makin menjadi hal yang sangat-sangat dibutuhkan oleh masyarakat. Oleh karena itu solusinya adalah entrepreneurship. Kita balik ke Gorontalo, buka lapangan kerja, gerakan ekonomi, pulihkan kehidupan masyarakat. Jadi pengusaha ini menjadi soal mindset kita. Bukan hanya soal permodalan keuangan, tapi mindset. Kalau dengar kata-kata nganggur, jujur saya jadi baper maksimal. Sebab saya pun sempat di PHK waktu krisis moneter tahun 1997. Tapi ternyata waktu saat itu saya nganggur, itu yang berat sekali. Sakitnya tuh di sini, ternyata menjadi sebuah hikmah. Saya akhirnya membuka usaha. Alhamdulillah usaha yang saya buka mulai dari cuma bertiga, sekarang bisa menjadi perusahaan investasi salah satu terbesar di Asia Tenggara dengan membuka lapangan kerja bagi 30.000 karyawan. You can do it also. UTI dan NOU bisa juga melakukan. Mari sama-sama kita bergandengan tangan, kita berikan ide-ide baru dan cemerlang agar kita segera bangkit dari pandemi dengan entrepreneurship, buka lapangan kerja, tingkatkan penghasilan masyarakat, dan yang terpenting, ringankan beban biaya hidup mereka. Sukses untuk kita semua. Billahi taufik wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
itulah dia UMKM Virtual Exhibition atau pameran UMKM yang dirangkaikan dengan keynote speech dari Bapak Dr. Sandiaga Uno selaku founder of Indonesian OKOC. Semoga dukungan dari Bapak Sandiaga Uno ini bisa memotivasi NOU dan UTI di Provinsi Gorontalo serta seluruh partisipan untuk terus berinovasi di masa pandemi COVID seperti ini ya Fauzi.
Benar sekali ya. You can do it ya. NOU dan UTI yang ada di Gorontalo khususnya dan umumnya ada di Indonesia ya harus tetap berinovasi di tengah pandemi COVID-19. Baiklah, dan ngomong-ngomong tentang produk UMKM, tadi sudah banyak juga ya produk-produk UMKM dari Provinsi Gorontalo yang tetap melakukan produksi di tengah pandemi COVID-19. Dan hari ini ya kita juga patut berbangga karena kita sementara mengenakan benar banget
sebagai representasi dukungan kita terhadap berkembangnya UMKM di Provinsi Gorontalo.
Benar banget. Jadi Karawang ini yang merupakan salah satu produk UMKM dari Provinsi Gorontalo dan ini telah mendunia. Iya. Benar banget ya. Nah, jadi Karawang ini merupakan sulaman benang ya yang membentuk motif atau pola yang variatif. Ya ada bunga ya dan lain sebagainya. Dan hari ini saya menggunakan Karawang dengan warna orange ya. Kalau Fauzia?
Saya menggunakan nuansa coklat dan gold.
Wow, cantik sekali ya.
Terima kasih Fauzi.
Oke, terima kasih juga. Dan kita kembali ke UMKM tadi. Ada banyak produk UMKM. Nah, ini yang mana Fauzia paling suka dari produk UMKM tadi?
Kalau saya personally lebih suka yang keripik pisang tapi dibaluri dengan keju karena kesannya lebih western kan.
Waduh, keripik pisang ya, tapi ada rasa keju di atasnya, ada taburan keju itu, wah, western sih ya. Oke.
Kalau Fauzi sendiri?
Kalau saya pribadi lebih suka tadi ada sambal sagela juara ya. Nah itu kalau mau dimakan ya, mau dimakan dengan umbi-umbian ya, dengan nasi juga itu enaknya, waduh.
Lebih universal ya rasanya.
Bener banget. Dan pedasnya itu berasa.
Iya.
Ya.
Memang Fauzi ini lidah Gorontalo.
Bener banget ya. Jadi untuk Anda semuanya peserta webinar ya, yang mungkin ingin mencoba produk-produk UMKM bisa langsung datang ke Gorontalo atau online shop ya. Nah, entah itu di Facebook, Instagram, dan lain sebagainya. Oke, Fauzia, selanjutnya kita akan melangkah pada acara yang ditunggu-tunggu nih ya. Bapak Ibu hadirin peserta webinar internasional, selanjutnya kita akan masuk pada acara yang ditunggu-tunggu yakni Seminar Internasional .IIC SDGs 2020. Dan sesi ini akan dipandu langsung oleh Ibu Ayu Anastasia Rahman MA selaku Kepala Kantor Urusan Internasional Universitas Bina Mandiri Gorontalo.
Okay. Ladies and gentlemen, the next agenda is the most anticipated agenda that we wait for, which is International Seminar for the 3rd IIC SDGs 2020. This session will be moderated by Ms. Ayu Anastasia Rahman MA as the head of International Office at University of Bina Mandiri, Gorontalo. Ms. Ayu, the floor is yours.
Thank you very much for the master ceremony. Welcome all participants. This is our 3rd International Interdisciplinary Conference on Sustainable Development Goals. As the 3rd year with holding this conference, we believe that this is a right time for us to adjust into new things, right? Including learning new languages. So for this conference, we will provide all English speakers to you, and we will have the translator ready in the chat box. Jadi Bapak Ibu peserta webinar, untuk translasi dari pembicara-pembicara internasional pada siang hari ini, kami telah menyediakan translasi di dalam chat box. Silakan bisa dibuka jika ingin lebih lanjut untuk mengetahui translasi atau bahasa Indonesia dari pembicara internasional yang akan berbicara selanjutnya. Now back to English. Today's theme is so much fascinating, so we raise the topic of innovation to empower rural communities during pandemic. Of course, as we know that since March 2020, the world is yet to face the brighter day. We are facing the global issues and millions are falling down into poverty. Children, elders are the most vulnerable into these issues. Now, humans are also being challenged and it affects many of our sectors in our lives. Therefore, we would like to bring the topics of innovation to empower rurals in the time of COVID-19. Truly, when the country closed the border, we believe that our local communities could be a hero to save our economy, to save our health. So therefore, we are very, very proud to bring to you 5 different reputable and also notable speakers, scholars, and professionals coming across the world. We would like to read out the CV one by one. We will start with the first speaker that will be speaking. This is Professor Dr. Nauzia Yasmin from Bangladesh. She is the Dean of School of Health Science, State University of Bangladesh. Also, we have the second speaker is Deputy Executive Director of Pangasinan State University, Professor would be ready to hear of his materials. And the last but not least will be the Professor Osterhaus coming from Germany, the advisory board of WHO or World Health Organization. Now, without further ado, I would like to call the first speaker of this conference. But before that, I would try to say hello and greet her first. Hello, Professor Nauzia Yasmin.
Hello, good morning. Assalamualaikum.
Walaikum salam. Are you ready for the conference?
Yes, very much.
Yes. Okay, so I think that your CV, you have a long experience in medicine field, right? Is that correct?
In the field of public health, yes.
Yes, yes. So it's interesting for you to bring the authentic and also your field experience and also thought about how is the effort of rural communities facing this kind of crisis. So we will have Professor Nauzia Yasmin to talk about rural communities in coping with COVID-19. We would like to give the floor to you, ma'am. Are you ready?
Yes, thank you.
Okay. So for the moderator, the admin, Bapak admin mungkin barangkali bisa share untuk PowerPoint dari
screen share.
Yes, yes, we will do the screen share.
Okay, can you hear me?
Yes.
Okay, good. Already you know I'm Professor Dr. Nauzia Yasmin from Bangladesh. So I'll be presenting on current situation and innovative solutions for rural communities of Bangladesh, which can be replicated in Indonesia and all the similar Asian countries. So just before we begin, I just want to say that this is not a normal situation we are in now, this year, because we are facing a pandemic. And we all know that for the last 7-8 months, we are facing this pandemic and we are all facing a lot of difficulties, physical difficulties, financial difficulties, mental difficulties, but we will try to overcome this, inshallah. And of course, with time, we'll learn how to cope with this new normal situation in our life. So welcome you all to my presentation. I'll just move on. First, we'll just have a look at some statistics. You all know, I'm sure, already you all know about this new virus that caused the pandemic. So it causes an infectious disease, which is called COVID-19, declared by WHO. And it started in Wuhan, China in December 2019. Then later on, the WHO declared it pandemic in January. And now it has transmitted to 47 million people around the globe, and more than 12 lakhs deaths already occurred as of November 4th. We all know these statistics, but still we are just going through it. But this same virus, the SARS-CoV-2, already caused 2 diseases before, like Middle East respiratory syndrome, MERS, and severe acute respiratory syndrome, SARS, but which was not that much pandemic at that time. but COVID-19 became pandemic. 214 countries and areas, 216 countries and areas got involved with this. So let's have a look at the some picture of COVID SARS-CoV-2. This is the electronic microscopic view of the virus. And another one. And let's have a look at the history, like how it begins. We already know that it began in Wuhan, China in December. First, it was a case of pneumonia. It was the case of pneumonia in December 12. They didn't know at that time it is caused by SARS-CoV-2. And the virus was unknown. So in December 31st, pneumonia these cases were reported to WHO. And in January 5, 2020, experts rule out the possibility of SARS and MERS. They rule out that this is not SARS and MERS, this is different. So in January 7, Chinese authorities identified the virus as novel coronavirus. And in January 30, you can have a look that WHO declared the novel coronavirus as global emergency. And in February 11, 2020, the WHO officially named the disease COVID-19. And it is going on. It is affecting a lot of countries. You all know that USA is most affected. Then we have got Mexico, India, and all the countries are more or less affected. And still up to November 7th, this pandemic is going on. And we are hoping that it will end soon, but we are not sure yet when. So we have to cope with it, and we have to move on with our lives with it by maintaining the health hygiene. So let's have a look at some statistics, like what are the confirmed cases already. You know, up to November 4th, there are 4,78,69,340 confirmed cases. Deaths, I already told, more than 12,20,803. Recovered case, this is a good thing that people are also recovering from it, like 3,43,69,995, and it has moved to 216 countries and territories, already have said. Transmission rate is 3 to 4 newly infected from one person. If one person gets infected, he can transmit to 3 to 4 persons. This is what we call transmission rate. And fatality rate is 3%, that is 3 deaths for every 100 cases. And we all know that the incubation period is 2 to 14 days. As this is a new virus, we are not yet absolutely sure about its pathogenicity and about its character. So we are working on it. We look at the data from different countries, and we want to know its characteristics. So let's have a look at the scenario of Bangladesh. In Bangladesh, the first ever confirmed case was detected on 8 March. To reduce the spread of COVID-19 after the detection of 8 March, and the death was reported on the same month, and then our government declared lockdown, or I would say general holidays from 26 March onwards, and and they extended it for several times for 3 to 4 months. Then all the educational institutions, all the offices more or less were closed, but eventually at the end of July, or by July, it didn't work that well because the COVID-19 affected all our 64 administrative districts by July, and also our everything got eventually was open, because we cannot, because of economic cause, because of our living, for our livelihood, we cannot keep everything closed for a long time. So everything opened except the educational institutions. In Bangladesh, number of cases and deaths due to COVID-19 is continuing to rise, though at a slow pace than other countries. I would say we are lucky. It is happening in a slower rate, the infection rate and the deaths. So this is a snapshot of the confirmed cases. So we have 4,10,988 confirmed case as of November 4th, 2020. Our deaths is 5,966. Recovered is 3,25,123. But still one death is not welcome. Like if one person dies, that's also very painful for us. So we don't want any death from this COVID-19. So we have to work together, all the countries, because this is a pandemic. This is the common problem of everybody's problem. So COVID-19 can be worse or can be fatal to people who have heart disease, who have like chronic disease like diabetes, lung disease, any HIV/AIDS, any cancer, or suffering from immunodeficiency. So what are the do's and don'ts? We all know everything. So like for the last 7-8 months, we have been listening to all these, but still we have to recap all this because we have to stay alert all the time. We have to take preventive measures. What are the preventive measures? You all know: wearing mask, washing hands repeatedly for more than 20 seconds, and also maintaining social distance or physical distance, I would say. And also we have to create healthy awareness for all the people, especially the rural people of any country, because the rural people are more or less ignorant, less educated, so they don't understand. We have to make them understand, and we have to make them aware of this scenario. Also, don't spread rumors. Sometimes people spread rumors like COVID-19 is only a disease of the rich people. It is not the case. COVID-19 is not the disease of the rich people. It can affect at any age, at any sex, at any race, religion. Everybody is prone to the disease if we are exposed to the risk. So what is the new normal? I just told you that we have to move on with our lives, because we cannot stay at home for like 1-2 years. What will we eat? What will we wear? Like, you understand my economic problem, social problem, physical problem, mental problem. So we have to maintain social distance. Already I have said we have to do hand washing, use face masks, use face gloves, hand gloves, face shield, head caps. Also avoid public gathering, avoid public transport, because it is transmitted from person to person. So you have to avoid public gathering when there is too many people in one place, or you have to, when you have to go to a public place, you have to maintain the social distance of minimum 3 feet, but maximum, like, it's better to avoid physical distance for 6 feet. So rural communities of Bangladesh, I already told that they are less educated, they are very simple people. So they are less aware, they're less willing to understand, and they don't practice all this health hygiene. But we have to make them understand, and overall the preventive measures and coping mechanism, we have to make them understand. Because if one person is infected, they are vulnerable. Everybody is vulnerable. So rural population are struggling. We all know that we are all struggling, but rural population is struggling very much because they don't have internet, they don't have online that much facilities, logistic facilities, physical facilities. So they are struggling physically, socially, mentally, economically. I have broken the problems and the solutions in 4 categories, like physical, social, mental, economic. So threat to physical health, less or no social distancing or other preventive measures, because they don't understand the meaning of social distancing. Social distancing means you will be standing or you'll be away from another person 3 feet away or 6 feet away. But sometimes they don't understand that. We have to make them understand all these problems, this social distancing problem. Also, there is no testing in rural areas. Less testing. In urban areas, there are some testing facilities, COVID-19 testing facilities and contact tracing, but in rural areas, testing facilities are less, hospitals are less equipped, and these are the problem of every country. And so, there is no contact tracing. And another problem is less or no idea about quarantine and isolation. I'll just tell you what is the difference between quarantine and isolation. When a person has symptoms of COVID-19 like cough, fever, runny nose, sore throat, this type of symptoms, we tell the person to go into isolation. Isolation means he'll go in a room. It's better to have a attached bath with the room, and then he'll be away from all the human contacts. He'll have his food and everything in that room. He'll be in isolation for 14 days. If he develops any further symptoms or if he gets worse, then we advise hospitalization. But otherwise, he can stay at his home and take treatment for COVID-19. But quarantine, when we say quarantine, when somebody, say for his family members is exposed to him, like he has got symptoms and family members came in contact with him, then but the family members doesn't have any symptoms yet. But we say that the family members will be in quarantine for 14 days to watch for any symptoms if there is any. Sometimes there is no symptoms. Sometimes the patient is asymptomatic. We all know that at least 30 to 40% cases are asymptomatic. WHO is saying that. But at least for 14 days, the person, if he or she remains isolated or quarantined for 14 days, then the virus will not be transmitted to the general community. And also, we all know that there is no definite treatment of COVID-19. Only symptomatic treatment we are doing. And all the whole world is working on making the vaccines for prevention. There is no treatment, but sometimes they say that this treatment will work, but sometimes the research data shows that treatment is not working. So this is trial and error type of thing, because this is new to us. I already told that we all know this disease is new to the world, new to the humans. So we don't know how to deal with it. We are just learning from this trial and error thing. Also, another physical problem is they have less access to healthcare facilities. I told you sometimes the village is a remote area. They don't have access to the healthcare facilities. So that's a problem. So let's have a look at the social problems, the social barriers, misconceptions and lack of knowledge about COVID-19. Almost same thing, like they have got some misconception. I told you that this is a disease of the rich people. Rich people get this disease because of AC. We live in air condition. But this is not the case. Everybody can get it, but usually rich people gets it because I think we stay more at indoors, and the rural people stay outside and they get vitamin D. Vitamin D is very good. It has shown that vitamin D is very good for COVID-19 patients, people like getting COVID-19. Vitamin D helps a lot. Also, less communication with one another in the community due to risk of spreading COVID-19. That's a problem, social barrier. Another is social isolation to the COVID-19 affected people and their family members. Like I told you, they have to go on isolation, the whole family, when one person is infected. So that's a problem. Also, they don't get help or support, adequate help or support to the COVID-19 affected people and their family, because of ignorance or misconception, or you can help other people who are affected, but maintaining the health hygiene, that is very important. You have to wear mask, you have to wear gloves when you go near a patient. So these are all social problems. So what are the threats to mental health? Mental health is a threat. During this pandemic, we have seen that a lot of mental problem is happening with common people, with rural people. So fear and anxiety of getting affected is a problem. Like we are scared that if we go out, if we don't wear mask, then we'll get infected. Fear and anxiety of getting infected. Panic due to misinformation about COVID-19. There are some panic, of course, for every disease there is panic, but this COVID-19 circulates panic among the general population. Also increased stress related to social isolation. When you are isolated for 14 days in a room, imagine yourself in an isolated place, not in contact with your family members, only you are in a room isolated. So there is a stress. It's a stress, of course. We all know that. This pandemic is a stress. I'm also facing stress. You are also facing stress. Every people is facing stress. So also there is impact on students due to closed educational institutions in Bangladesh, and most of the places are closed till now. From March, in our country, from March 26 to till now, 14 November, up to 14 November, it is closed. So students stay at home and they don't have anything to do, only they do online classes. So that's a stress, of course, mental stress. And family unrest due to financial problem, instability, that's another stress, because you don't have enough money to provide food for your family, to provide food for yourself, or to support the family with the treatment or with any other thing. So you all know that during this pandemic, a lot of people lost their jobs, lot of jobs were lost, and many people couldn't afford to live in the town. They had to go to village, they have to shift to village. So that's a mental stress, of course. Financial instability is a mental stress. We all know that. And also there is during this pandemic, all the family used to stay at home. So there's domestic violence. It was a problem, you know, beating, quarreling with husband, wife, family. Domestic violence was a major problem during this pandemic. And also another thing is early marriage, like increased early marriage, because sometimes, especially in rural areas, when everybody, they don't have enough to eat, they don't have financial solvency. So what they do is they try to marry off the young girl. So early marriage was a problem. So let's have a look to the economic, So the economic problem, the threat, I have already covered some, but there is less agricultural productivity due to this pandemic. People were at home, so they didn't have enough money or enough, I would say, thing to do agricultural productivity. Like agricultural production was less, hampered. And agri products transportation was also hampered because of this lockdown. Every country had lockdown or general holiday, so transportation problem of the produce. Then some local business got shut down because they couldn't maintain the employees and they couldn't maintain the local businesses, so they had to shut down the local business. Then a village market malfunction was there because no buyers. So if there is no buyers, then you can't keep the shop open. So village market had to shut down their markets and everything. So all these are financial threat. Also loss of jobs, already have mentioned that different sectors at home and abroad, there were a lot of job loss. In our country also, I have seen that a lot of people came back from the Saudi Arab and United Arab Emirates losing their jobs. They are in Bangladesh now and they don't have anything to do, no ready-made jobs to fit in. So that's a major problem. Overall, the people have insufficient cash for daily expenses because there was no productivity, so the salary was less. So the people didn't have sufficient cash to move on with their lives, like to deal with the cash daily expenses. So that was a threat to the economic problem. Overburden to the rural community, of course, this was a burden, the pandemic itself, and added to it was natural disasters. There were some natural disasters, especially in our country. There was cyclone Amphan, then there was monsoon flood in our country, and also added to this pandemic, there were some other infectious diseases like dengue. Dengue is a problem in our country. Cholera was another problem due to flood. There was some added infectious diseases, and also there is always existing nutritional deficiencies like moderate acute malnutrition, which we call MAM, and severe acute malnutrition, we call SAM. So like all these are always there, but it became worse during this pandemic because of lack of money, lack of productivity and everything. So what are the, so far I've spoken the problems, physical, mental, social, economic, but now let's have a look at innovative coping mechanism, how we can support the rural communities, or how rural communities can cope with this situation during this COVID-19 pandemic. So first, let's have a look that removing the physical problems. What we can do is for removing the physical health, the threats to the physical health, we can train the people from the community for mobile contact tracing. I'll be a little bit fast because I think my time is running. So we can train the people of the community for mobile contact tracing. Contact tracing is very important for any infectious disease. If a person gets infected, then we have to see whether for the last 10-14 days with whom he has come in contact. So this is called contact tracing, and we have to keep the contacts into quarantine. So mobile setup to collect sample from remote areas. This is also very important because I told you that in rural areas there are less infrastructure and we cannot collect sample. So if we can train the local people or local community hospitals to collect samples, that's another way. Also, we can demonstrate videos on hand washing, maintaining personal hygiene, using mask, how to do isolation, how to do quarantine, and also other preventive measures in local language. It can remove the physical health problem. And another thing is ensuring supply of hand wash, soap, mask, and preventive gears to the rural community. This is very important because they don't have money to buy the soap. They don't have money to buy the mask. So what we can do is we can train them, or we can supply them with the government and the NGOs. The non-government organizations can help in supplying the hand wash, soap, or teach them how to make mask, cloth mask with 3 layers. So also encourage people to maintain preventive measures through community workers, community health workers. They are the key persons to help the community, rural community, to deal with this pandemic. Also, we can develop information, education, communication. We call IEC materials with message on COVID-19, how to have, what type of food they should have during this pandemic, food and nutrition. Also, message on how to care the babies, also how to care for pregnant, lactating mother, children, and also reinforce transport facilities in every Upazila health complex. Like transport facility is very important because whenever they produce anything, we have to transport these things into our district so that they get sold, or they can they can supply all these things. But our government is helping a lot. They have during this pandemic, I've seen that our government has provided transportation or facilities for the farmers. Healthcare helpline setup in every Upazila health complex. This is also, we should do a healthcare setup online facility, so that if any questions they have, if they can't deal with any disease, they can talk with the healthcare providers in the district level. So removing the social barrier, we can do that, replace the word social distancing with physical. I told you that social distancing means in our country social. So people doesn't understand what is social distancing. We must tell physical distancing. This is very important. Also, we can aware the people of helping the families with cope with themselves, and also with the families who are infected. This is very important. We cannot just isolate them. We cannot just abandon them. We must help them. We must help them overcome the situation, how to get help. Also, we can train the community volunteers for assisting the community in need, like who are in need of according to their needs. So a rapid response team can be formed by the local leaders, engaging local people to solve the issues of the community. So this can solve the problem if we can engage the local people and make a rapid response team. They can help the families who are infected or who doesn't know where to go for help. So this can remove the social barrier. Also, we can strengthen the mental health problem by motivating people to be connected socially more and then distant physically. I mean, more connected through online or through telephone or social media, because we cannot be connected by physically because this is a infectious disease. And also we can promote educational video message on mental health promotion for children, adolescents, pregnant women, lactating women, and other vulnerable subgroups like elderly people, what they should do. They should take care of themselves, how they should take care of themselves, like this. And also we can telecast evidence-based message on COVID-19 and how to reduce the risk of getting infected. Thus reduction of panic, fear, and anxiety. If you maintain the health hygiene, if you maintain the distance, if you wear mask when you go outside, you can protect yourself. And if you can separate yourself from like distant, you can maintain distance of 6 feet, you can protect yourself. So this is very important to reduce fear, panic, anxiety. Also, we can train the local healthcare providers on mental health advocacy. This is very important. Mental health is very important normally, but during this pandemic, it is more important. Another thing is that we can ensure basic needs of the community by reducing their anxiety and stress related to daily living. If we can provide them some, if we can give them some financial incentives, some financial support, this will reduce their stress, and this will reduce their anxiety, and this will also enhance their productivity. So rebuilding the economic, how we can rebuild their economy, of course, this is an infectious disease, so we cannot go near anybody, we have to be distant. So we can train the farmers to do agriculture production, poultry, livestock production, fisheries, with maintaining safety measures. They can produce agriculture produce, they can do poultry, livestock production, fisheries by maintaining safety measures. Also, they can support the farmers with subsidiaries to bring them back in production. Government is doing that. Our government is giving subsidies to bring the farmers into production, agriculture production, livestock production, fisheries, anything. So we're trying, but still we need a lot to do. Also, we can adapt innovative techniques and tools of technology to the agriculture farming by following global agriculture and farming trends. How the advanced countries, how the developed countries are doing, how they are coping with this agriculture and farming trend. We have to learn from them, and we have to learn innovative techniques and tools for this agriculture production. Also, we can ensure uninterrupted transport mechanism for safe and quick distribution of agri products. Whenever any product is there, like say, for example, potato, rice, any vegetables, we need to be sure that there is transport mechanism is there to transport the products for selling and for storage, also storage facilities. Online village market can be reduced to re-establish the market functionality. Nowadays, online business is very much blooming. I buy a lot of things online nowadays. Before, I didn't used to buy. You all do, I'm sure. Online village market, we can also promote if the internet facilities is there. If we can ensure the internet and Wi-Fi facilities, they can do online village market, and we can buy products from them as well. Also, we can encourage the community to build multi-sectorial economy to increase the business and local job availability. Like all the sectors of development, the agriculture, fisheries, livestock, all the sectors of development should cooperate and coordinate with each other so that they can increase more jobs and more business available for the rural people. So I'm almost at the end of this. I'm sure that you have learned a bit from my presentation. So any vaccine or medication for COVID-19, we all know that no vaccine yet. We are, everybody is like a lot of countries, more than 200 countries are working on the vaccine, including our country is also working on the vaccine. I'm sure Indonesia is also working. but there is no vaccine yet, no specific medication, only symptomatic treatment. I have already said. So what should we do? So we have to move on with our lives. We cannot stand still, or we cannot stay locked down for a long time. We have to move on, but maintaining the health hygiene. So we have to move on. Life goes on, and we have to, for living and for survival, we have to go out. But every time you go out, you have to use mask, and no compromise on hand washing, and no compromise on social distancing. So we can't compromise on health safety to be safe, as prevention is the first and foremost key to fight this pandemic. And this is the first vaccine, I would say, because prevention can prevent me from getting infected. And also, if I can prevent myself getting infected, I can prevent my community as well. So I think that I have said enough, almost at the end. I hope I didn't bore you. So thank you very much, everyone. I hope that you have got at least some points from my presentation. And as I'm a public health specialist, I urge you, please do not make any mistake of maintaining the health hygiene. If you go out, please use mask. At least use mask, and try to sanitize your hands or wash your hands frequently, and also try to maintain the social distance. So stay safe, everyone. Stay safe and well, and thank you very much for inviting me. Thank you.
Thank you very much, Professor Nauzia, for the great presentations. The first one down, and we have few more to go. It is also interesting to talk about how local communities is going to help to get through this pandemic and hard situations. Bapak Ibu sekali lagi bisa melihat translasi dari speaker di dalam box chat, itu bisa sedang berlangsung untuk translasinya, penerjemahan dari bahasa Inggris ke bahasa Indonesia. Tentunya pembicara dari Bangladesh, yaitu Profesor Nauzia, menyampaikan berbagai aspek terkait dengan bagaimana cara memperkuat utamanya kesehatan publik dari lokal communities atau masyarakat lokal, dan mengingatkan juga kepada kita untuk terus memperhatikan protokol kesehatan, karena fenomena pandemi ini bukan hanya melingkupi di Indonesia saja ya, tapi hampir di seluruh negara merasakan dampak negatifnya. Hampir di seluruh negara itu saat sekarang dalam kondisi isolasi dan tidak bisa melakukan aktivitas sebagaimana mestinya, dan mesti berperang melawan hoax dan berbagai rumor seperti itu. Baik, thank you very much, Professor Nauzia. That's a great session. We will have the question and answer session at the end. Now, I would like to continue to the second speaker, which is Professor Keng Tungu, PhD. May I greet you, sir? Hi.
Yes.
Yes.
Yep.
Okay. Yeah. 1 second. I think admin bisa bantu saya untuk mempin agar Profesor Keng Tungu bisa masuk di layar, muncul di layar. Okay, sir, how are you?
Fine. Thank you for inviting me.
Yes. What time is it in Taiwan?
Yeah, it's the same in Indonesia.
Oh, right. Same with Indonesia. Okay, this is a very special occasion because I just noticed that you graduated from the same university.
Oh, really?
Yes, we actually have the same alma mater or alumni of the same university.
Yeah.
Which is the University of College London. So Professor Keng Tungu is actually holding a PhD in chemical engineering from University of College London. However, he took it in 1997. I just graduated in 2017, so quite recent. Okay, 1 second. I would like to. Okay, yeah. Now there you go. Okay, so Dr. Keng Tungu is associate professor in Department of Forestry at National Chongqing University of Taiwan, and for the research interest is in biomass thermochemical conversion, bioenergy integrated with microgrids, which is the topic that he would like to present to us today. Are you ready, sir?
Yeah, sure.
Okay, you may now share your screen, and the floor is yours.
I try to share my screen.
Yeah.
Did you see that?
Yes.
Okay.
Yep. Yeah.
Right.
Okay, sir, just a friendly reminder. So because of the time limitation, so you probably have 10 to 12 minutes for presentations. I hope that's okay.
Yeah, sure, no problem. Yeah, I need to let my
Bapak Ibu, sebelum mulai, kalau beliau ini khusus untuk membahas topik teknologi dan lingkungannya, environment and technology. Jadi memang topik beliau bicara tentang biomass gitu, dan bagaimana itu bisa bermanfaat untuk masyarakat di daerah, khususnya atau rural communities. Yeah, I think it's in the bottom right. You see the full screen. Yeah, the one that, yeah, that one. Yeah.
Okay.
The one that you just click.
Yep.
Yeah, there you go.
Yeah, thank you very much. Ladies and gentlemen, it's my honor to join this conference. In a very short time, I would like to introduce about the innovative small-scale biomass gasification power generation system integrated with the portable microgrid for rural communities. I think I have left the PDF file to everyone, so I will skip some slides in order to save some time. And where we are, I think you can see the map. We are up of the Indonesia. Actually, I have been Indonesia many times, especially in the Manado city. So in Manado city, it's I think it's the east of the you now. There is a 9-hour drive from the this conference site to Manado cities. We have some cooperation with the Manado city and also Lipi. And we are the bioenergy research co-laboratory at National Zhongxin University. That lab is found in 2007, and we are in the central of the Taiwan. I think that's first I would like to introduce what is the biomass gasification. Although it's a very complicated one, but the problem is you can just thinking about that we are convert the solid fuel into the gas fuels. That means you not direct burn of the like agricultural waste like wood. You burn is gas like you using something petroleum gas, not the liquid as well. So that will be keep your energy efficiency very large, and also it's very clean. And that the advantage of the biomass gasification that we using the gas fuels converted from the solid feedstock, so that can be avoid the large amount of the PM 2.5 produced by the direct combustion of the solid fuels. And also the emission of the NOx and the CO2 are very low, especially the partial oxidation reaction leads to the low residue oxygen content to avoid the production of the chlorophenol, the dioxin precursor. So you can see here, if we burn the bio waste, that means you use a lot of the oxygen. So in the incinerator, you will leave a lot of the oxygen, and then you will produce the dioxin. But the problem is if you use a gasifier, we just using the little bit oxygen, so the chlorine will react with the hydrogen in the syngas. So you will see the HCl there. It's only very slightly corrosion of the pipeline, so not so easy to produce the dioxin. So gasification is a quite good process to convert the solid fuel into the gas fuel and then to get the power. And so the some very small scale there's a biomass gasifier is still have some problem. That means it can be to treat the gas very cleanly, because the small gasifier cannot set up the expensive gas cleaning system, cause the generator to be malfunction frequently, and also it's difficult to get the power. So moreover, they always employed the waste scrubber to remove the tar, produce the wastewater, and then operation cost is increased. So now we are to improve this system, we call the OTWG power generation set. That means we don't have any tar and we don't have wastewater, easy to operate. This is the good things, and also can be integrated with the microgrid system. So a microgrid system, that means it's a simple system, scalable, and also easy to operate, easy to maintain, and reduce some investment in power lines. So for example, you can see that we got a lot of agricultural waste from the farmland, and then we put into the gasification system to generate the power. And then we can send the power to microgrid. This is the original one system, but currently we want to thinking about we just set one gasification system in one location, so we can just produce a lot of battery, a lot of the electricity, and then to charge the battery. So we will have a portable battery charging room. After that, we just bring the battery to each microgrid areas. So you don't need to set up a lot of large gasifier in every village. It costs a lot. So currently, some of the PV system, you can see that every village they set up a lot, but the problem is it costs a lot as well. So we just to collect all the battery together. So you can see that if we set up a 100 kilowatt electricity agricultural waste gasification power generation system, that would be provide 400 households, but the free stocks for 8 hours per day. Every hour you need to feed the 500 kilogram agricultural waste. So that's our demonstration site in Taiwan. You can see that the microgrid is very small one. You see this box there as only 5 kilowatt that can be produce the power for 20 households. So it's very nice to do that. So this is a kind of large one micro system. It also is very small. We cooperate with the Zhongxin company, and you can see that one of the hot swap battery. That means we can just put in this system in some village. So you just to put the battery inside, and you can see that this is a safety remote and insert the battery into the microgrid system without powering down the machine itself. So it's very nice because the biomass energy, the capacity factor is 0.84. It's similar to the nuclear power plant. It's quite high efficiency compared to the wind power or the solar PV. So we have some exhibition last year in the KOCC in Kuala Lumpur, and unfortunately this year we can't go there. So we have some promotion case currently is carry on. And last I would like to introduce some impacts of the COVID-19 on bioenergy sector, because the it's quite affect a lot about the biofuels, liquid biofuel, for example, biodiesel and bioethanol, because of some transportation needs the liquid fuels. But currently they have no more transportation events, so quite a lot of jobs have lost. But for the solid waste, I mean the solid bioenergy power system, you can see this does not affect quite a lot. So it's still very good during this COVID-19 event. So I have a quote, the 5 World Bioenergy Association message, especially for the COVID-19 recovery for the policymakers. First one is bioenergy as the essential service. That means this is easy to do, and you can find that waste, agricultural waste is quite a lot. You can pick up that and easy to serve to meet your requirement. And also bioenergy future, that means you can, it's a very important key role in reducing the fossil fuel used, generates job, local economy development, and also combating the climate change. And also that's the bioenergy also can be provided some key to the insensitive the fossil fuels. As you know, the most southeastern country they have some subsidy for the fossil fuels, but that will be increase some carbon dioxide emission. So if we introduce some bioenergy, that means you don't need to use a lot of the fossil fuels. And the fourth, you can bring back better with the bioenergies. That means you can use a very cheap the fuel cost. For example, the agricultural waste is quite a lot, and the cost is very cheap, even the free. So there's a normal fossil fuel support now. And that the 51 is a time for the ambition and the action. And that means we face climate urgency, and also national governments must increase in their climate ambitions by setting long-term ambitions and a stable target for the bioenergy and the other renewable energy. And finally, the key for the capacity building bioenergy for the rural community in the time of the COVID-19. That means bioenergy is essential in the energy transition. So because I have mentioned about the capacity factor is 0.84, it's quite large. So it's easy to transfer your energy usage from the fossil fuel to the renewable energy. And also very important is the bioenergy resilience. That means it's easy to recovery from some events, for example, the typhoon or other times, for example, like the times of the COVID-19. It's easy to recover your power system. You can still using your powers. And finally, I have 2 slides to say that 2000 successful on using the bioenergy. The first one is the supply. That means you have a lot of biomass feedstock. And the second, you must consider about the quality of the bioenergy. And finally, you will thinking about the costs. This is thinking for future R&D orientals. And then development of biomass application concept. We just finished a project. We proposed RETIS concept. RETI, that means regulation, you need the law, and economies, technology, all the things you will need to integrate all together. So especially if the local government without any regulation, we can help them to help the local government to set up the regulation, and then you can carry on the other biomass technology. That's easy to do that, and then we will consider the economies. All the things must be integrated. So we still need to some a company, for example, I put a small s, RETIS, there's a social enterprise, can be held to do everything and put together. So it's easy to develop the green energy in the rural areas. Finally, I was thinking of thanks about the Taiwan's Minister of Science and Technology to provide the funding to the research. and especially at the times that we can meet each other in a really conference size. So one of the older poems, it is close to the mountain stream and the foreign lands, but we actually share the sun, moon, and also the air in the same sky. So I hope that the next time we can meet each other, especially for the maybe the next year conference. So that's all my presentation in a short time, and I hope you can understand this, and I can leave this PDF file there, and if you have any question, you can contact me directly. Thank you very much. Thank you.
Thank you very much, sir. This is very interesting because you probably know that Indonesia is an agricultural country.
Yes.
So in Gorontalo, yes, in Gorontalo, we have one of our popular commodity is corn. We are exporting it to other countries as well. So I believe also in this occasion, we have invited the Vice Governor.
Mm-hmm. Yep. Can you hear me?
PhD berbicara tentang biogas ya, atau adalah sumber energi yang terbarukan. Biasanya kalau kita ngomong berasal dari bahan bakar seperti batu bara ya. Nah, kalau sumber energi yang terbarukan menjadi gas dan bisa menghasilkan listrik. So we'd like to say thank you very much, Professor Keng Tunggu, for your time. We will probably have just few minutes before we're going to continue as we are looking for the next. So at the end of the session, we will have the question and answer session. I hope you can stay because it's. Hi, Jim. Are you there? Hi, Jim. Okay. Since I believe harus sudah bisa mengadmit Jim Baker ya. Probably, sir, you want to explain a little bit about the you see as the potential of the agricultural, probably the province like Gorontalo, for example, because we already heard how Riau in Indonesia have become one of the biomass potential as well. Do you have few words about that? All right. Now we are looking for the next speaker. Probably, Dr. Keng Tunggu, can you end your screen because it's still in your. Yes, thank you very much. Now we are actually looking for the next speaker. From United Kingdom dari Inggris karena zona waktunya cukup berbeda ya, karena di Inggris sekarang masih jam 7.30 pagi, jadi harapannya pembicaranya sudah ready nih. Hi, Professor Jim Baker. Jim Baker, are you here? Okay, so I think I'm just going to directly continue to the next speaker, I would like to perhaps greet Professor Osterhaus. Are you here? You can unmute yourself. Sir, Professor Albert Osterhaus, are you here? Yes. Yeah, you can unmute yourself. We are putting you in a co-host, so you can unmute yourself. Yeah.
Okay. So you
Hi,
can
sir. How are you?
I'm fine. Can you hear me?
Yes, yes, clear and sound. Obviously, because your speaking time will be after Jim. However, I think Jim have some technical problems. So is that okay for you if kind of shift the time and you go first? Is that okay?
That's fine with me.
Okay. Before you are going to continue, I need to read your CV because I'm so excited. We are honored to have you here in Gorontalo. So we are live in Gorontalo in a studio of our university. Jadi Bapak Ibu, saya bacakan sedikit CV dari beliau. Beliau ini adalah salah satu Dewan Penasehat dari Organisasi Kesehatan Dunia atau WHO dan salah satu riset atau peneliti penemu dari virus flu di tahun 2006, dan sekarang beliau juga termasuk salah satu yang sedang melit untuk penemuan vaksin COVID-19. And we are very lucky to have you, sir. Now, Professor Osterhaus has been the head of Department of Viroscience at Erasmus Rotterdam until 2014, and is currently director of the Center of Infection Medicine and Zoonosis Research and guest professor at the University of Veterinary Medicine, Hanover. He has a long track record as a scientific researcher and principal investigator of numerous major scientific projects. And at Erasmus MC, Professor Osterhaus has run a diagnostic virology lab with more than 40 staff and a research virology lab with over 150 personnel. Wow, that's a huge number of staff that you got over there. His research program follows a novel integrated viroscience concept, bringing together the world-leading scientists in molecular virology, immunology, epidemiology, pathogenesis, and intervention studies on human and animal virus infections. Among the major accomplishments are the discovery of more than 70 new viruses of humans and animals, including human metapneumovirus and coronaviruses, influenza viruses. So he has a very long experience, and as a notable scholars, obviously this has enabled the health authorities like the WHO to effectively combat disease outbreaks like SARS and avian influenza by the help of Professor Osterhaus. The international recognition of Professor Osterhaus is further highlighted by major prizes, guest lecture and invitation like today's international seminar, and co-organizership of international of scientific journals. The Commander of Order of Dutch Lion. Now that's a profile from the Professor Dr. Albert Osterhaus. Sir, you have all of 10 or 15 minutes. Do you think you can manage? Oh, sorry, you're still in mute mode.
So I had planned for 25 minutes, but anyway, I'll try to.
Yeah, that's okay. That's okay. We just try to make it 15 minutes, but if you still have things to talk about, perhaps we'll cut the Q&A time and then give you more time to explore and then explain to us your topic. Please, the floor is yours.
Yeah, can somebody help me because I cannot share the screen.
All right. Okay.
You have disabled my screen sharing. Could you enable me?
Yes, sure. Bapak-bapak di administrator mungkin bisa menjadikan Profesor Osterhaus sebagai co-host agar bisa share screen sendiri. Okay, can you do it right now?
Well, it doesn't work yet because it
Okay.
says that it's disabled.
Yes, 1 second. Gimana Bapak-Bapak moderator, admin, IT, apakah sudah bisa menjadikan Profesor Osterhaus sebagai co-host? Okay, I think you can, we will try to connect to your host right now, and you can just, yeah, right now you, yeah.
There we go.
Yes.
Make it full screen. Okay, there. Can you see it?
Yes, clear, very clear.
Okay, though. So I'm going to talk about pandemic preparedness. So what could we have done before this pandemic, and what did we forget to do? And perhaps more importantly, what can we do for the next pandemic? Yeah, because this will definitely not be the last one. And what you see here on this slide is just an overview of the things I'm going to address briefly. Yeah, these are the points coming all the way from early warning systems to all these different items to communication at the end. And I will give you some experiences from the past and show you where we stand. And at the end of my presentation, I will come back to this table. So basically, this is when it started. It all started in December last year, almost a year ago. And then we had the very heavy lockdown in Hubei province, and in the other measures were all taken in the other 32 provinces, and really brought it under control quite rapidly in China. And if you look at basically the very strict and severe measures that were taken in China, and you look at and you compare that to measures that were much more lenient in other countries, you see, and you look at the economic outcome, at the end of the day, you see here that China, South Korea, Singapore, and all these countries that had a strict lockdown were doing actually much better than for instance, the European countries. And it was very early on, talking about communication, that the Chinese Minister of Health was alerting the world already in January, as you see here, that this particular virus could already spread, be given from one person to the other, before any symptoms would be there, even in people who didn't develop any symptoms. So I think early warning systems is very important. This slide here, you see an example of what we did when we first diagnosed H5N1 in Hong Kong in '97, and we immediately alerted WHO and the world at large. So I think it's important to do syndrome and laboratory-based surveillance for humans and animals alike, both by medics and veterinarians, and we are quite dependent there on the laboratory-based diagnosticians, rapid molecular characterization of a virus, and rapid reporting according to IHR and other systems that are in place. And you see here, very early on, the Chinese were already alerting the world for a new virus or new disease to be there. And very rapidly, the Director General of WHO, Dr. Tedros, he said, it's very important to find every case, isolate it, test it, care for them, obviously, and then trace and quarantine every contact. So I think that was an important message. Communication at that time was crucial, but still most countries in Europe and North and South America did not in time take this seriously, I should say. Well, then virus characterization, virus identification, fighting new viruses. And this is from my own work here when I was in Erasmus and now in Germany. You see the viruses that we have discovered. The red ones are the human viruses. The blue ones are the veterinary viruses. So this is an ongoing thing with new technologies, deep sequencing, new molecular techniques. It's very important. And we have learned from the Chinese now that what we did, let's say we discovered the MERS coronavirus, we co-discovered the SARS coronavirus, SARS-1 coronavirus, and it goes faster and faster. Back in the old days, when we first discovered human metapneumovirus, it took a couple of months to identify that. And now the Chinese identified the SARS-CoV-2 and characterized it and had this full molecular sequence within a period of about a week. Well, this is then how we, with SARS, organized a press conference in WHO, because we had identified with a big group all together with people from people from Asia, people from Europe and North America. We were sitting together. We had a dozen of laboratories all together, and we were sitting together on a daily basis on a teleconference at that time. We had no Zoom at that time. We didn't have those Teams, those Zooms that we have today. It was just teleconferences. We were having a daily meeting, and at the end of the day, 2 viruses were being found: the metapneumovirus on the one hand, and the new coronavirus. And as a matter of fact, we did a monkey experiment there in elderly monkeys and showed that the monkeys infected with the coronavirus, they developed SARS. So that was, so to say, the Koch's postulates. And we also looked in older monkeys, what the type of disease was. And you see here, when we compared young adults versus elderly monkeys, as you see here, the lung lesions were much more severe in the older animals, and we did transcriptome analysis and found out it was especially also the absence of a good interferon response in the older monkeys that was important. Okay, we had the monkey model, and so we tried, like we are doing today, many groups are doing today with antivirals. We tried different things, and you see here pegylated interferon alpha that was used at that time extensively for hepatitis C, chronic hepatitis C. And as a matter of fact, you see that when we used it prophylactically, but also post-exposure, the replication of the virus was stopped. At that time already, there were many groups that were working on a vaccine, including ourselves. And we organized a meeting in Rotterdam where we brought together all the candidate producers of a SARS coronavirus vaccine. And you see a lot of different methodologies were being used at that time. And as a matter of fact, the Chinese group here, they were using a whole inactivated virus. And we actually discourage them to do that further, because as you can see here, we did a similar experiments with monkeys again, and then with that vaccine, an adjuvanted vaccine with alum in this case, different concentration. And you see, after challenge, they developed some hypersensitivity in terms of eosinophils in the lungs. So that's a word of caution at the moment. So then we discovered the MERS coronavirus. That was an elderly man in Saudi Arabia for the first time, was by Dr. Zaki, who was working there in Saudi Arabia. And he sent his material from this patient. And to cut a very long story short, we identified yet another coronavirus, the Middle East respiratory syndrome coronavirus. The red peak here is an outbreak in Korea, South Korea. And what you see here already at that time, very rapidly, we and others started to make vaccines using DNA vaccines, VLPs. We were working on an MVA, etc., adenos. And so basically the technologies that are being used also to date. What we also did together with Christian Drosten's group from Germany, we actually produced diagnostic tests, and we were disseminating the first PCRs, second generation PCRs, to more than 150 labs in the world, just to be able to be quick on the ball. In the meantime, we identified the dromedary camel as the intermediate host between the bats, because we know these coronaviruses originally come from bats. It's true for SARS coronavirus, for MERS coronavirus, also the new coronavirus. And so by showing antibodies in camels, in dromedary camels, also we showed at a camel farm that in the camels, the same virus was present as in the people that came down with the disease there. That was quite an extensive study at that time. And also within 2 weeks, we were able to identify the receptor of the virus. So we did an experiment. The first experiment we did was a vaccination experiment in camels. We found negative camels, and we vaccinated them with a pox vectored vaccine that expressed the spike protein of the MERS coronavirus. And we actually showed quite rapidly that when we immunized camels, and you see here the conge of the camels, here these on the left-hand side is the vaccinated, on the right-hand side, the non-vaccinated camels, and we see the virus being present after challenge. So we did that, and that is the basis for clinical trials that are ongoing in humans at the moment, with the MERS coronavirus vaccine that was tried in camels. So this was also the basis for the CEPI funding. CEPI is the organization that is funding, and we did that. We started all these experiments long before the SARS coronavirus 2 came up. And actually this particular thing is going into phase 2 at the moment. And also you see the same technology is now being used in Germany to make a SARS-CoV-2 vaccine, based on the same technology. And so this was actually a program that was started as a European project where we worked on coronaviruses and Bunya viruses as potential pandemic viruses for the future. And actually now also CEPI is funding a big project now on Bunya, on a Bunya virus, on Rift Valley fever, on a Rift Valley fever vaccine. So being prepared in peacetime, so to say. In the meantime, whilst we had immunized the camels, we know that camels make single chain heavy chains antibodies, and as a matter of fact, by cloning and eventually making a chimeric antibody, we made chimeric humanized heavy chain only antibodies from those camels quite rapidly. Within a couple of weeks we had a whole panel of antibodies, and subsequently using again the money from this European project, we were also able to actually have a monoclonal antibody produced, a monoclonal antibody that was raised against MERS, SARS-CoV-1, cross-reacted with SARS-CoV-2, and that one is now being expanded in the framework of some European projects for human trials. So talking about vaccines, you see here from the New York Times. Those of you who are interested in how fast, where are we going with vaccines, it's very good to follow this particular website of the New York Times on a daily basis. Basically, this is from November 1st. They show what kind of vaccines are in clinical trials. So phase 1, phase 2, phase 3, limited use, 6 at the moment. And when we look at the different technologies, so we were working, as I said, we were working on vectored vaccine with a viral vector here. We were using the MVA. There's different approaches there, but whole inactivated, live attenuated, subunit vaccines, DNA, messenger RNA vaccines as well are all being tested at the moment. We haven't got the vaccine yet, but we may expect that the first vaccines will become available for larger use at the beginning before the summer of next year. The problem is, of course, when you look here, this from the Serum Institute of India on the right-hand side, where they say not enough COVID vaccine for all will be there before 2024. So still a couple of years to go. And this is, if everything works well, you see by the end of 2020 and the end of 21, you see that. So it will be quite an effort to get the vaccine for the world. Well, now you see here the numbers of cases that we have here from March. So confirmed cases. Obviously, the diagnostic capacities at the beginning in March were not good enough. And you see Asia, including India and the Middle East, is doing relatively well. Also Australia and New Zealand, because they went for very stringent lockdowns. And after that, after the lockdown was effectuated very gradually with a very good system of quarantine, of testing, identifying contacts, tracing, and eventually quarantining, it became very well under control. Well, you saw how South America was doing, North America, and at the moment Europe is really in a very bad shape. Well, just as an illustration how important it can be to do a complete lockdown, this is here what happened in Israel. It went up like it went up in the Netherlands. I used this example for the Netherlands, and as a matter of fact, they implemented in the 18th of September a very strict lockdown, and you see how fast within 2, 3, 4 weeks you go towards an R0 that's less than 1. So this is very important to realize. So I have basically come now to my conclusion slides. I've shown you what early warning systems can do, how important it is in animals and humans alike. Pathogen discovery, that is very important, that you can do that fast with the molecular techniques, that you develop diagnostics as soon as you can and distribute that, as is being done at the moment for the SARS-CoV-2. We are talking also about about mathematical models to monitor what the effect of intervention methods is. Setting up animal models in BSL-3 facilities is quite important. Running clinical trials, all the non-pharmaceutical interventions and treatment strategies, as we all know, that have been implemented so successfully in some of the Asian countries, and then the pharmaceutical intervention strategies, going for antiviral platforms in peacetime, actually produce or develop antivirals that work, that are very broadly active. Yeah, the same for vaccines, that you make vaccines that cover whole families or groups within families as broad as possible. I think that's quite important. We can do that all in peacetime, and we can, of course, work on biological response modifiers as well. And then finally, communication is a crucial thing, as I showed you. So I think this is kind of things that we should be doing in peacetime. And I think we largely neglected that before the last pandemic. I think for the next pandemic that we may expect in the next decades, I think that we should invest heavily as kind of an insurance policy to make sure that this is all going to work better and that we will be better protected. So this is acknowledgements of the money that we have got for all the work, a lot of European projects, NIH projects, national projects, and then you see this is all collaborative work. You see here the work that we have been doing with several other groups here. And so this is from Erasmus and my German group at the moment, collaboration with SARS, flu, MERS, and the group is much bigger still. So this is just a selection. So I hope I've given you some overview of what I think is quite important to do in peacetime to be better prepared for the next pandemic. Thank you very much.
Thank you very much, sir. We will have the Q&A at the end of the session. Okay. But before that, one question for me. Do you believe we're going to have another pandemic in the future, seeing the current situation?
Well, once this pandemic is over, I think when we were starting to warn the world some 20, 30 years ago as virologists that a pandemic would be coming for sure, and that came at the time that most of the infections in the Western world, at least, were under control. So all the childhood diseases, we were vaccinating, smallpox was eradicated, and then we really became complacent. And then gradually we got all these different things. We got the Mexican flu, we got Ebola, we got chikungunya, we got huge outbreaks of dengue as well, as was just said. We got MERS, we got this new coronavirus. We will have for sure, we will have another flu pandemic for sure. We cannot avoid that. And it's really the way in which we use our planet today that makes it very clear that we will have more and more epidemics and pandemics in the future. So we have to be better prepared. Over.
Yeah. Thank you very much. So we have over 800 participants here across the disciplines and of course backgrounds. There are students, there are lecturers, there are professionals, and also government officials. So we are glad that to have that kind of information for us, especially because people are panicking, in different nations, and we think that it's a good thing that we know that it's better for us to prepare earlier than continue with fear and anxiety. Thank you. Bapak Ibu, baik, sebelum saya lanjut ke before I continue to the next speaker, saya ingin memberitahukan juga di chat box sekarang ini sedang berlangsung translasi atau penerjemahan dari tim kami. Silakan untuk dilihat. Tapi memang yang disampaikan oleh Profesor Osterhaus tadi adalah karena beliau sendiri merupakan periset leading researcher untuk penemuan virus-virus seperti MERS, kemudian seperti influenza gitu ya. Jadi memang beliau adalah pakar di bidang virologi gitu dan epidemiologi. Jadi buat Bapak Ibu yang pengen mengajukan pertanyaan, silakan untuk sebentar di sesi Q&A akan saya buka, bisa bertanya khusus untuk teman-teman yang penasaran untuk bertanya langsung kepada seorang penemu virus influenza di tahun 2006 itu seperti apa sih pandangan beliau. Yang pasti kata beliau tadi, kita akan para periset itu sudah bisa pastikan bahwa kita akan menghadapi pandemi lagi di masa depan, tapi yang paling penting adalah bagaimana mempersiapkan dari pandemi yang sekarang agar kita bisa jauh lebih siap dan jauh lebih resilient atau kuat dalam menghadapi pandemi depannya. Okay, so before continue, I will check out our speaker that have spoken before adalah dari disiplin ilmu kesehatan masyarakat atau public health, dari ilmu teknologi lingkungan atau environmental technology, dan sekarang dari kesehatan khususnya untuk virology and epidemiology. Selanjutnya kami akan mengundang, we would like to invite the next speaker coming from our neighboring countries, which is the Philippines. We would like to greet Dr. Cristeta Dulos. Dr. Dulos, are you here?
Yeah, good afternoon. Good afternoon.
Good afternoon.
Yeah.
Okay. Allow me to read your CV first, right? Okay.
Sure.
Okay. So her name is Professor Cristeta Dulos, Dr. Cristeta Dulos. She is from the Philippines and hold the doctorate degree from Doctor of Philosophy in Rural Development from Benguet State University with scholarship. Wow, that's really great. And also she has made as well awards for the awards itself. She holds the Outstanding Administrator for Local Governments of Bayambang Pangasinan, April 2013, and a Award of Commendation at CHED Regional Office, and Certificate of Recognition as Accreditor. She is also the renowned speaker for many of international and national conferences. Obviously, her field of research and her expertise will talk more about the development of rural area. So we were going to talk to her very, very soon. Are you ready, ma'am?
Yeah, can you see my sharing of slide?
Right now, not yet. Can you do the share screen now?
I'm really trying to have it shared.
Yeah.
Just for a minute. May I?
Yeah, sure. So while Professor Dulos tried to working it out for the PowerPoint, I'd like to say also for the other speakers that have spoken before, thank you very much. We hope you can stay with us because just at the end of this session, in 30 minutes, we will have Q&A session. Obviously, will be addressed to all the speakers, so we will really appreciate it if you can stay. And we have received a few, and can we say a lot of questions
share screen.
Speakers. Ay, naka-open na ba? Pardon?
Yan, hindi pa rin niya makikita daw eh.
Can you share it, or do you want us to help you? Oh, right, your screen's right now.
Okay.
Yeah.
Is she now?
Yes. You can open your PowerPoint now because it's still in your. Yeah.
Can you see now my slide, my PowerPoint presentation?
Not yet. It's now freeze on your Windows downloads folder.
How is that? Just for a minute. I'm sorry. We are having a little bit poor connection here.
Yeah. Oke, untuk yang memberikan pertanyaan di chat box, barangkali nanti tim bisa melis pertanyaan in English. Jadi saya bisa menyampaikan pertanyaannya kepada. Ya.
It is being shared already.
Okay. Do you want us to share it for you?
Sure. Can you do it for me?
Okay, we'll try. Bapak-bapak di admin di bisa di IT bisa untuk share screen presentasinya Dr. Dulos. But the problem is you have to be a little bit louder when you say next because they cannot hear a loud voice. So they cannot hear your voice unless you're being loud. So if that's okay, you can just say next in a bit clearer voice.
Okay.
Okay.
Can you see it now? Yeah.
One second.
That's my.
Okay. Yes, yes,
Okay.
yes. Now
So
it's being shared screen by our
your technical expert, I'm sorry. Yeah, good afternoon to everyone. And it's so really I am really filled with joy and elated of your invitation. And actually I am really humbled that I am a part of this very important occasion. Okay. So what really I'm going to share with you is somewhat how could we ever cope up with this pandemic, especially for government workers and especially those who are rural development workers like me. Actually, I am both an educator and at the same time a rural development practitioner, because I belong to a part of the extension program of our university. So my topic for today is rural development amidst global crisis, particularly this pandemic. So what makes a rural community a good place to live, a good place to work, run a business, start a family, and grow old? How one enjoys the benefits of staying in rural areas and sustains the quality of life it offers to the dwellers. It is a whole variety of factors, from the quality and accessibility of services like schools and healthcare to natural resources, and even social trust and community leadership. Recognizing these elements, countries in the world now are implementing a range of policies to deliver rural well-being, embracing a holistic lens on rural development, focusing on well-being across its many perspectives. So rural development, next slide please. Rural development has emerged as a distinctive field of policy and practice of research in the last decade. So may I just tell you, or just a glimpse of what rural development as a discipline all about? Because this is very, very important area. How far have we gone in coping with this pandemic? So the term rural development refers to a distinct approach to interventions by the state in the economies of underdeveloped countries, and one which at once broader and more specific than agricultural development. So people who are not really in this field sometimes equate rural development as an agricultural development. That might be true, but let's try to look at the different parameters of rural development. First, rural development is seen as a process. Why? Because it is a series of action or steps taken in order to achieve a particular goal in the community. So it is a neutral, it is a scientific term subject to fairly precise definition and measurement expressed chiefly in social relations. So its emphasis is upon what happens to the people socially and psychologically. And it is a process that moves from one stage to another stage, improving the condition of the community, and where major decisions are made by the people to effect change for and of common concern. That is rural development as a process. Now let's take a look at rural development as a program. So when we speak of a program, it is really a distinct feature of any activity because it comes into contact with subject matter like health, welfare, agriculture, industry, and recreation. Emphasis is upon the activities of the people in the community. Now, as a method, rural development as a method, because it is a means to an end. It is procedural. It would work out on that some goal is attained. No? And the process is guided for a particular purpose, which may prove harmful or helpful to the local community, depending upon the goal in view and the criteria of one passing judgment. Another, rural development as a movement. Why movement? It changes the physical and the location and the position of the community and the people itself. It is sometimes, rural development is sometimes called as a crusade to which people become committed. It's not neutral, but carries an emotional charge, one that is dedicated to progress. It is a movement because it becomes institutionalized. No? It is building up its own organizational structure, accepted procedure, and professional practitioners. It stresses and promotes the idea of community development. Now, as an approach, rural development is a holistic. It is grounded in principles of empowerment of people in the community. It deals with human rights, inclusion, social justice, determination, and collective action. It is the idea of a positive approach to handling the affairs of the community and developing the initiative of the individual and the people, and obtaining the willing participation of the people in schemes for promoting their own betterment. Now, as a philosophy, rural development as a philosophy, we always deal with, oh, we have to develop the rural community. But as a philosophy, remember that man, as the end goal of development, views the improvement and transformation of his community. Of course, we always look at that we want really the community to become self-sufficient, sustainable, so that the next generation will have something to inherit for their own development. So development is conducted for total community change, resulting from a democratic form. Why democratic form? Because it is the people themselves who work for their own development. It is by the volition, the concerted effort of the people to work together as one, which is participation with an expression of self-reliance. And the last is, we view rural development as an administrative reform. A while ago, I heard one of the speakers said that rural community is one that is depressed, is one that is neglected. It's true. So we come up to a point that we have really to anchor this activity, rural development, to enhance the capacity of our administrative system, to look into how the governing bodies in the community really works for the common good of the people. Remember that the highest philosophy here is that we work for the highest good of the greater majority. That is a democratic way of helping the community come up, no, to be rescued from whatever deficiencies, from whatever inadequacies they have. Now, we come also to know what are the elements of rural development in relation to this pandemic. The first thing is we have to build on community assets. Problems or unmet needs can be springboards of action, but action occurs through the use of resources. So, in this, we know that community or rural communities are very rich in asset, natural or human resources. We have raw materials that can be found in our community. So with this simple act of action, we can build a better community for our people, especially in this time of pandemic. Now, what is the first action? Simple act. Joint effort to solve common problem democratically and scientifically on a community basis. Like what I have said, democratically, rich or poor, young and old, boys and girls, they always have something to say for the development of their community. Everybody has its own share. That's why the paradox of here, or what's the tagline here is that let's have a shared leadership, let's have a shared responsibility. Number 2, activities must correspond to the basic needs of the community. Exactly. What we are doing for here, is it not to fill in the basic needs of the community? Why are we doing such kind of development activities? And what are the basic needs of the community that should be addressed as a priority? Number 3, there is a need also to have concerted action and establishment of multi-purpose program. What multi-purpose? Remember that in community, it varies. The kind of people, the group of people. In a community, we find several groups, several organizations that they interact differently from each other. So despite differences, despite diversity, we should be united. We should be in unison for the common good of the people. Number 4 is revitalization of existing forms of local government and effective local administration. Remember that what really matters in the community is really to have our existing policies, existing programs of the government be in consonance with the kind of leadership we have. So we have to establish a strong local leadership. And then we have identification, encouragement, and training of local leadership. Assistance from the government. Well, we always know that government is always there to help us in times of need. Despite of the fact that the government has also some sort of weaknesses, still there is a need not to understand, because not one, not you, not me alone can do the development, but it is you and me. Everybody should take part in this kind of endeavor. Now, initiative comes from the people themselves. Exactly. No one can do, no one can plan for you except you alone. You know your basic needs. You know what you need. You know what the community needs. So there is a need for us to go on with trying to initiate, coming from own volition and voluntarism. Next one is process of stimulation of a change agent, adoption of consistent policies, specific administrative arrangement, training of personnel, mobilization of local and natural resources, adoption of voluntary NGOs should be used at all levels. Why NGOs? Because what is the trend now is there should be private-public partnership. There should be strategic partnership between and among government and non-government organizations, because our leadership cannot just do it alone, but we need really partners in the realization of these goals for community or rural development. And mutual relationship and close coordination between the local and national level. Next slide, please. As COVID-19 pandemic has flooded the world and infiltrated many of the rural and most impoverished communities, attention has turned to what the future will look like. To build back better at the community level, there are a number of development issues that need to be addressed. Some aspects particularly relevant to COVID-19 includes, well, actually, this was given or shared by our previous speakers as far as health is concerned. But this time, let's try to look at one of the issues that is confronted. No, we are being confronted this issue at this time of pandemic is education and communication about physical and mental health risk. I will not dwell so much on mental because Ma'am has already discussed fully and comprehensively regarding health side. However, let's try to, in the field of education and at this time of pandemic, let us be prudent about reducing the spread of disease when widespread and consistent information is not available. Let us raise awareness of the symptoms and early warning signs, as well as the creation of any disaster risk mobile system in our community. And this system would assist in the early detection of any symptoms or signs that may arise. Access to mental health resources, especially to lower and middle income families, because there can be an increased demand for such services brought about by the stigma associated with disease and stressors, such as socioeconomic challenges that could worsen mental health problems. Next one is the safe interaction with public places. This one, food, shopping centers, grocery stores, shopping mall are useful examples of necessary trips to public places. However, such trips could be dangerous to physical health due to exposure. It was already explained further. Now, next one is there is a shifting of values and preferences. Now, this is also one problem confronting us at this time of pandemic because it may contribute on how people live and work. There is that feeling of individualism, extreme nationalism, skepticism as what should be done? How should we do about it? No? How long will it take this pandemic? There is really that change of perspective, thoughts that we worry so much. So naturally, there is what we call change in how we perceive our everyday condition and situation at this time of pandemic. Now, in the Philippines, we really have that kind of bayanihan in which we found out that in this time of pandemic, we learn the culture of sharing. We learn the culture of helping one another. Because there is a saying na no man is an island. And also, there is also the change in lifestyle now. We observe that people, particularly in our community, we tend to become simpler now in lifestyle. We can no longer do what we used to do before, because of the closure of some establishments, closure of some shopping malls. That really that really made us change our perspective as far as our preferences, choice, values, and attitude, our behavior is concerned. Now, another issue or challenge that is posing this pandemic is the future of our food. No? There is really a limited food literacy, including effects on food waste, awareness regarding the benefits of synthetic food, unequal distribution of power in the food chain. And since we are looking into rural places, the concern is what would happen to our farmers? What would happen to our producers? There is seemingly a great effect on the supply and demand of food in the market. No? Especially so the influx of this kind of diseases would really affect the kind of food intake we have. So there is really a need to educate our people, to give them some sort of training, education that they need so that they could cope up with this kind of situation. Now, the future of our education, basically, all of us here who are students are now in the verge of having that kind of adjustment from the usual practice to the new normal. So it is a global trend now that online or flexible learning is in the air, that whether we like it or not, we really have to embrace this kind of change in our educational system. Despite of the fact that many students cannot cope up with this just because of the socio-economic status, just because of the different orientations we have in our family, we cannot just cope up, but we can always go with it. We can always live with it. Now, for as long as we believe in ourselves that we really can do it in the future. Next one is this, another challenge brought by this COVID is digital connectivity and new technologies. Now, digital connectivity and new technologies, internet connectivity is the foundation of digital economy. You agree with me, no? And in the case of rural areas, there is a limited connectivity in rural areas, and where they are available, services are relatively expensive and of weak quality. So there is really a need to upgrade our digital infrastructure all over the country that would introduce fundamental changes. And with this, if there is what we call improvement of our digital connectivity, then it would improve our social service delivery, enhance our resilience against shocks, and create more economic opportunities, not only for the Filipinos, not only for the Indonesians, but globally we are speaking of this. Now, this, as COVID-19 has been aggravated by globalization and provided insights into what shape future pandemics may take, it is imperative that rural communities be included in addressing this phenomenon. Despite the massive economic and demographic impacts brought by the pandemic, small towns continue to creatively focus on new opportunities for growth and development. Economic innovations and a focus on the cultural facets that make small town or villages unique, comfortable, and desirable have helped many communities create their own renaissance. The future is bright for much of rural communities, as small towns or villages embrace the notion that their citizens and their cultural uniqueness are important assets. Now, we have better rural policies for better rural lives. For over 2 decades, the Organization of Economic Cooperation on Rural Policy, which are basically applicable on rural development, are based on the premise that place-based policies should deliver well-being to all. We're not only talking here of economic well-being, but the total facets of development of human being: physical, cultural, emotional, social, even economic. Next one is support sound multi-level governance and community-led development, prepare rural areas for technological, demographic, and environmental change, address the diversity of challenges and opportunities facing rural areas, and be informed by sound evidence and data at right scale. However, these policies should be translated into innovative strategy to fully empower the community and the people as well. Now, so what are some of the innovative strategies? Number one, maximize the potential of all rural areas. Remember that despite being deprived, depressed, and underprivileged, rural communities have that great potential for growth and development. All we have to do is just to leverage the unique assets of each rural area to adapt and respond to these emerging megatrends. And what are these megatrends? We have the digitalization, globalization and trade. We have climate change, population aging, and even urbanization. And adapt policy responses to different types of rural region, including rural areas inside functional rural or urban areas, cities and their commuting zones. Next, organize policies and governance at the relevant geographical scale. So implement rural policies at different scale that match with functional relationship. Encourage the efficient and effective provision of public services and infrastructure in order to maintain quality and accessibility, address market failures, and respond to emerging needs, especially in underserved rural communities. Next strategy is to support interdependence and cooperation between rural and urban areas. Remember that rural and urban areas cannot be separated. They are always in partnership with each other. So also leverage the spatial continuity and functional relationship between rural and urban areas in order to inform public investment and program design and carry out joint strategies and fostering win-win rural-urban partnership as appropriate to promote an integrated development approach. Next strategy is that to set a forward-looking vision for rural policies. Improve well-being for rural dwellers across economic, social, and environmental objectives, and ensure that responsibilities and resources across levels of government are clearly defined and effectively aligned with national targets and strategies, place specific needs and the sustainable development goals, and ensure that rural policy objectives benefit from foresight studies are measurable at different scale, that is, and connect to policy levers. Next strategy is leverage the potential of rural areas to benefit from globalization, trade, and digitalization. So create an enabling environment for rural areas to identify and invest in their areas of competitive advantage, such as tradable activities and adding value to rural assets. Invest in digital connectivity to enable the use of next generation technologies in rural areas, such as cloud computing, artificial intelligence, the Internet of Things, and blockchain technologies, among others. And facilitate the decentralization of production through supportive policies and regulations. Another innovative strategy is support entrepreneurship to foster job creation in rural area. The one mentioned to us by our first speaker, it's really very beautiful. He showcased some of the small and medium enterprise in Indonesia. That is what we are trying to drive out. Support small businesses, support potential and local entrepreneurs. We have to start from where we are. We have to start how we live, and we have to start what are the available resources we have in the community. So from there, we can capacitate people. No, we can train people for livelihood. And from there, we can encourage, no? And we can motivate, especially the young ones, to come up and appreciate the resources in the rural areas. Because as we observe, you know, millennials now prefer to stay in the city. They live behind rural areas. Now, why are they leaving rural areas? These are the so-called push factors. They push these millennials to go to the city because they see that city has a very lucrative life. It gives them that kind of fulfillment of their dreams. But behind the rural areas, there lies a goal, something that can make us grow and develop into better, into bigger. That's why I used to encourage my students. Why prefer to city if there are potentials and opportunities in rural areas? Why still go and teach in the city if right there and then in your community, there are a lot of young people who need your services? Why still go to city if right then and there in your community, there are a lot of wealth, wealth that has not yet been discovered? We try to look into how people live in the community. And as educators, as rural development workers, we should be the change agent. We should be the one to change their paradigm. Let's try to shift their paradigm as far as livelihood, as far as education, as far as development is concerned. Now, next one, that is supporting entrepreneurship. We have here align strategies to deliver public services with rural policies. So assess the impact of key sectoral policies on rural areas and diagnosing adaptations for rural areas are required. Another is recognize where policies and regulations create additional barriers to the provision of public services in smaller places and responding with innovative solution. And develop a smart rural villages. How could we develop a smart rural villages and towns? Well, having it smart, there is the promotion of digitalization complemented by training for public sector personnel and residents to navigate and use e-services. You know, in the Philippines, we tap the resources of our local government. There is that perfect partnership between university and local government. And we found out that since majority of the students cannot really have that accessibility as far as technology is concerned, we made an agreement with the local government, with the people in the community, local leadership, to help the university come up with a sustainable communication, providing them internet or Wi-Fi connection to our students so that they could access to the kind of flexible learning the universities and other colleges in the Philippines are offering.
Ariman, your time is
okay, and to end my talk, although there is still more to Probably during the Q and answer, I could answer them. So in closing, rural development is a chain reaction. One aspect affects the other. It is multi-sectoral and multidisciplinary. It brings a total package of initiatives, and it starts from the people themselves to physical and geographical development. So as we move forward amidst this pandemic, the COVID-19 presents opportunities for us, especially for local government, to rebuild better our communities in a more inclusive, sustainable, and resilient way. With that, I thank you very much for this opportunity. And I'm so glad to have you here in this kind of important occasion. Thank you, and God bless everyone. Thank you for listening.
Thank you very much, Dr. Dulos. This is a very interesting topic because Gorontalo is still one of the developing provinces in Indonesia. We're not up into that mega cities yet. However, we are before the pandemic, we're doing a great job in terms of economic development, especially in terms of Human Development Index. So I think that your presentation is a really great and specifically contextualized to developing rural area. Jadi Bapak Ibu, sebelum masuk ke before going on to the next speaker, tadi yang menurut saya yang paling menarik adalah ketika yang dibahas adalah pembangunan desa gitu. Jadi topik dari Dr. Dulos tadi ini banyak berbicara tentang bagaimana sih desa itu menjadi wilayah di mana orang itu senang tinggal di dalamnya. Jadi bukan orang pemikirannya harus berpindah ke kota yang besar karena di sana ada sumber daya, tapi perlu kita ketahui bahwa dengan datang ke kota yang besar seperti Jakarta ada fenomena overpopulasi di sana. Karena walaupun sumber daya dan teknologinya luar biasa bagus, tapi kompetisi untuk mendapatkan sumber daya itu juga luar biasa beratnya gitu. Jadi menurut Dr. Dulos yang memiliki PhD di bidang rural development atau pembangunan desa gitu ya, desa harus dibangun. Jadi menurut banyak riset tentang pembangunan, karena saya juga alhamdulillah keilmuannya juga di pembangunan, memang desa adalah salah satu savior dan hero gitu, pahlawan untuk membangun sebuah negara yang jauh lebih kuat dan tahan terhadap global crisis seperti pandemi ini. Thank you very much. We would like to have the more question. We already note down the question here, but we will present to you the next speaker, which is Jim Baker. Jim, are you here? Hi Jim. Jim adalah salah satu pemateri dan pemateri terakhir kita. Beliau adalah pakar di bidang flipped learning dan cloud computing. Kalau sekarang kita menggunakan banyak aplikasi online di bidang pendidikan. Nah, hari ini kita mendatangkan pembicaranya yang mempionirkan teknologi pendidikan itu. Nah, untuk lebih lanjutnya kita akan ngobrol-ngobrol dengan Jim Baker. Jim, are you here? Can you hear my voice?
Yes, I can.
Hi, Jim. How are you?
Hi, fine, thank you. You?
Yes, thank you. I'm fine too. What time is it in England?
Sorry, what time?
Yes.
9 minutes past 8.
Right. So it's you have the same time zone with Professor Osterhaus from Germany. Is that correct?
Right.
Right. Okay. Without further ado, we'd like to give you the floor. So will you be comfortable to share it by yourself? Is that okay?
Yes. So if I can share my screen.
Yeah, you are being assigned as co-host, so you definitely can share it by yourself. Yeah, you are share screening right now.
Right, so you can see my screen.
Yes.
Right. Now, what my passion is to repair the nonsense many call education.
Right.
In this day and age, sorry,
sir, before I continue, perhaps I would like to remind you about the time. Can you make it 15 minutes so we have more time for Q&A at the end of the session? Is that okay?
Yes.
Yeah, okay. Please, the floor is yours.
So am I okay to go?
Yes.
So this is the presentation that you should all have access to. That the especially now with COVID, that online working is the future. I tell my students that they should not be doing anything in class that they can do on their own without me. Likewise, I should not be doing anything in class that a non-specialist should do. So I share the whole year's work with my students from day one. So on Google Calendar, can you see my shared calendar?
Yeah, Jim, sorry to interrupt again. We can see the calendar.
Okay.
Can you turn on your video? So it will be, is it okay for you?
Sorry, is the video not on?
Yes, the video is not on. Yes, now, yes, we can see it. Okay. Yes, we can see the screen.
Is that better?
Yes, much better. Thank you.
Right, so I give my students the whole 2 years' work online on Google Calendar. So I'm in school just on a Monday.
There's
so
one entry for today. At 8:30 a.m. You have IU conf.
I'll just put my phone off, sorry. So you can see that on a Monday, I have a year 13 and a year 12. So my students, they prepare for that lesson. So if I go on to November and November the 9th, which is Monday, then if I click on that calendar item, then my students are doing transition elements. So they have all the resources there ready for the lesson. So what happens is my students do not have homework, they have prep, i.e. they prepare for the lesson beforehand. So the lesson is spent as it should be, them asking me questions on the parts they didn't understand, and also they work through the questions in class, so I'm there to help them. And this encourages independent learning. At the end of the 2 years, they have an exam, and the exam consists of 3 papers. So one of my students asked if all these separate calendar items could be put in one place. So what I created on Google Drive I'm going back to my drive again. I'm going back to presentation links. So the beauty with this is the students can access their work 24/7, 365 from any device. So I'm going to presentation links again. So here, there are 2 years. There are year 12 and year 13. They're the 2 years of the course. So the students, when they come to revise, they can choose any topic on the 2 years, because some people may want to revise one topic, some another. So they can actually choose which topic they want to revise and click on it, and they have all the links for that topic. So this is giving the students control of their own learning. And this really encourages them, because you are not there what I call force feeding. What most teachers do, they stand at the front and force feed information for the students, and the students don't like this because they cannot follow the PowerPoint, they cannot follow the instructions, and there is no time to ask the teacher. And teachers do not like being asked by students, particularly if they can't question. So what is the point of putting PowerPoints up in the lesson when the students can actually watch them on their own outside lessons? Also, if a student, with this flipped learning, if a student is watching a PowerPoint outside of lesson, if they do not understand it, they can repeat and replay the PowerPoint as many times as they like. Whereas if they're watching it in class, they cannot do that. They cannot keep asking the teacher to repeat the PowerPoint. Does anybody want to ask any questions at this stage?
Sir, the Q&A will be after you're speaking.
Sorry?
So the time for Q&A will be at the end of the session, so you may continue.
Right. Now, I want to share this with you. So can I put these on the chat?
Yes, sure, sir. You can share the material on the chat.
Right. So
yeah.
share.
But we've also sent it spread it to the audience, so they actually have it with.
Good. Copy link. Copied. I'm looking at the. Screen. If I stop sharing, I chat. That is the link to my presentation links.
Ya, jadi Bapak Ibu di chat box sudah ada link presentasinya Baker, jadi bisa di.
That is my. That's the link to my website.
Yeah.
I want to also show something called Twidget. I'm going to.
Okay, while you are looking for the screen, I will give a brief explanation to the audience in Indonesia. Is that okay?
Yes.
Oke, Bapak Ibu, jadi sekarang karena beliau ini fokusnya ke teknologi pendidikan ya, jadi untuk para pendidik-pendidik itu bisa fokus ke aplikasi yang digunakan, kemudian tadi metode-metode dalam melakukan pembelajaran digital atau pembelajaran online gitu ya, supaya mahasiswa atau siswanya itu bisa partisipatif dalam sebuah proses pembelajaran. So did you get it already? Okay.
Now I'm going to share my screen again.
Yeah. Just a quick reminder, Jim, we will have the Q&A so can you finish it in 7 or 8 minutes? Because we have
now.
Thank
you. There is something called Twidget, which is marketed as social networking for schools. Again, this is a free platform, so I, as a teacher, can add as many students and as many classes as I wish. So the students can have access to this 24/7, 365 online. So if I open my Twidget, I can put all my classes on here, and if I open a class, then I can post anything here. Also, the students, this student here, they can post things outside lesson. So if they are thinking of something that's been done in class and want further information, they can actually post on here, as this girl did, would methane be more volatile than butane? I receive an email if somebody's posted, and I can then get back to this student and give her the answer when she needs it, not having to wait until next lesson. I can put all useful links on here. Also on here, I can put videos to topics that we've been discussing in class. Also, I've got the whole 2 years course on this platform. So the students, for any topic, they can just click on a link and receive information on that topic. And this can be accessed on a computer, mobile phone, or a tablet.
You are likely familiar with the test for carbon dioxide.
So the students have all their work online. And the beauty of this is, after lesson, they can still continue with the work, because many books have to stay at school in class for another class. Whereas when they learn this way, most of the students have mobile phones, computers, so they can access all their work when they want. They don't have to wait until lesson time. So if a student arrives one day and is upset because one of the pets have died, they've had an argument with the parents, they may not feel in the mood for learning, but it doesn't matter because they can continue online at a time when their mindset is more ready for learning. So essentially that is it with flipped learning. It's called flipped learning because what normally happens in school, the students accessing information, they actually get the information outside of school at home, and in school the homework that they normally do outside of school, they actually do it in class when the student is there to help them. So no time is wasted in class, because the feedback I get from students is that the teacher comes in and just force feeds them with information, and there's no time to ask questions. Whereas all my lessons in class are devoted to receiving questions that the students want to ask. And we can get through the work a lot faster. And if you want to look at some of the comments in my guest book, to me, that says it all. A lot of the students say, why couldn't we have worked this way lower down the school? Because it makes complete sense. On my presentation, there are some videos on there about flipped learning. So again, this is the idea of giving the audience information beforehand, because they don't need me to show PowerPoints, because they can do that themselves. What they really want is to question me on this way of working. If I there are a lot of links, as you've seen on the presentation. Drive. Possibly the best. Links. I hope you should be able to access all these hyperlinks.
Yes.
So on this one, there are videos here on short videos on the flipped classroom.
Every day, 7.2 million students walk into classrooms throughout the United States. These classrooms generally look the same. 30 students sit in rows of desks, taking notes in their notebooks, while the teacher stands at a whiteboard teaching a lesson. Regardless of ability level, each student receives the exact same information at the exact same pace. As Ms. Jackson presents the same material, the students respond differently. Tommy gets it, while Allison is bored, and Maria is lost. At the end of the day, the same students head home. While at home, they sit at the kitchen table doing their homework and trying to remember what Ms. Jackson said.
Sir, sorry to interrupt. You have 3 more minutes before the discussion of Q&A.
Grammarly does more than catch errors. With Grammarly, you can find really good, no, perfect words that make your writing sharp.
This one is possibly the best one on the flipped learning.
The flipped classroom. Let's reverse where traditional homework and lecture take place. Now, I must warn you beforehand, watching this presentation can literally turn your world upside down. The first thing most educators are going to ask is, why flip? Well, here are a couple reasons to consider. With a flipped classroom, the content becomes available to students beyond typical classroom time. Students are now able to access the content anytime. Benefit that comes with viewing content in video format is the ability to stop, pause, play, etc. Students can write down questions about the content at home. Then, when students enter the classroom, they are already prepared to ask these questions to their teacher. When a teacher flips a class...
So those videos on there will explain about the flipped classroom. There's 1 or 2 of my podcasts there and articles there, and 2 more presentations on flipped learning. So all the information is actually there for the audience to reflect on and watch at a later date. So when I trained a school in Cyprus in 2014, I sent all the information beforehand. So my hour with the students, with the parents, with the staff was spent them asking me questions on how this worked, and questions they wanted to know how it could be applied to their subject. And to me, this is what presentations should be, with the audience actually having read about it beforehand and then asking the presenter, can you explain this? How does this work? So I actually practice what I preach.
Okay. Do you have anything more, Jim?
No, I think that sums it up, because as I said, the presentation can be accessed by the group anytime, anywhere.
Yes. So it's flipped learning.
Does
It's really
that make sense?
interesting. Yeah. Yes. It's really interesting because we got a couple of questions probably you will want to answer here about flipped learning. So is that okay if we now continue to the Q&A session?
Yeah, sure. Yes.
Okay, so thank you very much for the last speaker, Mr. Jim Baker. All of the links that Jim have mentioned before, we have spread it to the audience, to the and we will copy the link and then we will paste it to the chat box, so like newer participants will be able to access to the link. Jadi Bapak Ibu, link yang akan diberikan nanti itu adalah link berisi semua materi yang mengenai flip learning. Kalau tadi inti dari flip learning itu kan sebenarnya adalah membalik ya, flip learning, pembelajaran yang dibalik gitu. Jadi kalau biasanya mahasiswa dan siswa itu kita jelasin PowerPoint pada saat kita lagi Zoom seperti ini, menurut Jim ya karena mahasiswa sudah bisa mengaksesnya di luar daripada mata kuliah gitu. Jadi nggak perlu untuk kita jelasin di dalam mata kuliah. Nah ini yang akan akan barangkali bisa didiskusikan ya, barangkali Bapak Ibu punya pertanyaan. Kita akan buka untuk 2 saja video pertanyaan yang akan yang ready in English ya, yang bisa dalam bahasa Inggris supaya kami tidak menerjemahkan lagi. Kemudian kita sudah punya beberapa pertanyaan dalam bahasa Inggris, itu di chat box juga bisa menyampaikan pertanyaan. Okay, Jim, thank you very much. We'll now enter the Q&A session. So I will read out the question for each speakers. Barangkali admin bisa bisa membantu ya nanti untuk pertanyaan pertama. The first question is for Professor Nauzia. Professor Nauzia, are you still here? Okay, I think there's some technical problems. We'll just move on first before we going back to Professor Nauzia. Professor Osterhaus, are you still here? Yes, okay. So we have a couple questions for Professor Osterhaus. The first one is coming from one of the faculty members, the head of study program of one of our partner universities dari Stitek Bina Taruna Gorontalo, Ibu Siti atau Miss Siti Fatmawati. So her question is, it's interesting because it's also talk about pandemic. She said that there are some doctoral holders coming forward and stating COVID is human-made with ill intention. The question is, number one, if that's true, what the role of UN plays in this situation? Second, how does WHO, as the organization of health in the world, respond on this intellectual challenge coming from some of these doctoral holders? And also, how much, the third question is, how much do you think the vaccine will be successful once it's finished?
So the question, if I understand it well, is about the task, the function of UN organizations like WHO. So what I was talking about to a large extent was the interaction between human medicine, the veterinary medicine, and the environmental biology. And as a matter of fact, I think a lot of coordination now in the so-called tripartite, that means the collaboration between the 3 organizations, WHO, FAO, and OIE, is becoming more and more important. I think a lot of the planning that's being done for the human pandemics is actually being done on behalf of WHO. So the WHO brings together expert teams that actually look into the possibilities to counteract these threats. I should say that that obviously WHO is an organization that facilitates all these things and actually sets out priorities with their expert groups. Same is true for OIE and FAO. I think, however, what we really need to do in the future is, on the basis of these advices that we get from those organizations, which is important, I think it's quite important to actually invest in the things that I was mentioning. So especially being prepared in peacetime in terms of developing vaccines, developing antivirals, but also the early warning systems, etc. Obviously, already there is a good early warning system in WHO functioning for influenza especially. And there is a system of some, virtually all countries in the world are connected to that in some way or the other. So there is a system where we have more than 150 laboratories internationally being guided by WHO to bring in all the information about influenza strains that are being picked up basically on a real-time basis. And I think that organization could be used to a large extent for other new respiratory infections, and that's being looked into. So I think there is a major role to play there for these UN organizations. On the other hand, I think that all the stakeholders, and that includes all the countries on the one hand, but also universities, academia, but also the private sector, the companies they should all work together to be prepared for the future. And I can give you examples. I gave one example of how we are gearing up for making more universal influenza vaccines, more universal vaccines against coronaviruses and the like. So that's a long answer to say, in principle, I think there's an enormous role to play. Obviously, there is a downside that especially where WHO is involved, the funding of WHO is at risk to date. And I think we have to make sure that this organization will get the support from the national countries as much as possible. Over.
Yeah, thank you. Do you have also respond towards these some of these people who have the degree in medicine and say that COVID is not true and try to like provocate societies? Do WHO respond on that or just ignore that completely?
Well, I think that's a very difficult thing. If you look at all these conspiracy theories and all these people who don't believe in vaccination and the like, that is as old as humanity, I would say. Even if you go back to the times of Jenner, who developed the first vaccine so more than 200 years ago, he was being blamed already, and there were this anti-vaxxers, people were already there. And I think there is always some 5%, 10% of the population that will adhere to that. The question is how to tackle that. I think it's very difficult, of course. And if you see, especially when we're talking about compliance as far as vaccination is concerned, I think that people do not realize how important vaccines are. And if you realize that only by the eradication of smallpox, but also by the control of childhood diseases like polio, like mumps, measles, rubella, what have you. All these different infections are getting more and more under control, and we are saving many millions of lives every year. People who don't believe that, or people who are not, don't want to buy in and say it's not natural. So I'm afraid they don't get the point. I think indeed, I'm a veterinarian by training originally, and if you see how these things are being arranged in nature, obviously dying is a natural thing as well. Yeah. So we have, if you look at the most animal species, if you see how many young animals die in the first year of life, we had a similar situation with humans, obviously. If we go back a bit more than 100 years, 50% of all mortality was due to infectious diseases. And it was really thanks to, well, all kinds of sanitary measures, but also vaccination and the development of antivirals, antibiotics, that we have reduced that to less than 1 or 2%. So I think it's completely ludicrous for these people not to buy into the concept. And if you ask me what is WHO doing, it's not just WHO, it is the world community should fight against that in a way, not so much to tell these people that they are wrong, but to show these people how many lives are being saved at the annual basis. Over.
Thank you very much. Okay, we're going to ask the next question for Dr. Keng Tungu. Are you here?
Yes.
Okay, so we have a few questions for you. Let me just read out the first one and then, okay. All right, so what do you think, why do you think the countries are hesitant to shift into the biomass source of energy, you know, since if it's cheap and if it's, you know, clean, why do you think the country's still hesitant?
Yeah, I think there's the renewable energy. We still have some problem about the high cost and also the efficiency is more concerns by a lot of the people. For example, for the wind wind power, if you don't have any wind at the summertime, and then probably you will require another electricity. And then, for example, in Taiwan, we also have a strong wind in winter time. But the problem is that in winter, we don't need, we have no any heating system. And so we a lot of the electricity will generate more than summertime. But the problem is that in summer, it's the high demand of the energy. And the second is, for example, the PV solar. It's only on the daytime you have a power, but in the evening or in the night, you can't find any power. So the storage system is very, very important. But the problem is you can't build a lot of the or large system for the storage, for energy storage. So the capacity factor for the PV always is about the 0.14, or for the wind maybe the 0.818. I don't realize, I don't want to say that's not important, but the problem is for the base load, I mean the base load, that means currently they use the nuclear power or the coal-fired power. It's the base load, but the PV system and wind power system is difficult to be the base load. So only the biomass, because of the capacity factor is similar to the nuclear, so it's an opportunity to be the base load, especially for the rural area. It is easy to get the biomass restock compared to some wind power or the solar power and easy to handle it. So you got a free stock. So that's easy to build up. Because why I said about the microgrid, for example, we have visited Manado city and some rural area. If you want to build up the power plant, you need some line, you need some transmission facility, and from the central power station to your home, probably you need the couple of years to do that. So I always say a joke when we set up a power plant there, probably your child has to go up. So probably distributed, the separated distributed power generation, for example, microgrid is very fast. We can build it in half a year, so it's easy to do that. And also, it can be a kind of a resilient system. For example, if we have a typhoon in Taiwan, always we have a shortage about the power, and if that is only local distributor system, we are easy to handle it. We don't need to worry about the power line. Probably we are hurt by the typhoon or other they digested the something very 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 bad. So that's why biomass is very important. I think in Indonesia or other southeastern countries, it's very nice to have a lot of biomass. But in Taiwan, we have still some problem about the biomass because of the transportation and also collection. The cost is quite high. So probably it's easy to promote in the southeast country, especially for the rural area. I hope I can answer your question. Thank you.
Right. Thank you very much. Yes, I think that we are more and more, we are all agree that rural development is one of the most crucial things to get through this pandemic, either as in health, in education, or even in development in general terms. Now, we would like to have the question for Professor Nauzia. Professor Nauzia, are you here? Ma'am, are you here? Can you hear my voice? Are you still in the...
Unmute me, please.
Yes.
Yep. Thank you.
Yeah. Is that okay for to ask a question? Few questions that I got here for you. The first one is, what do you think is the most challenging one, especially in public health, that rural communities are facing right now, especially in terms of new normal?
Yeah, the first thing is they don't maintain the because of their economic, physical, and mental health barriers. They don't actually practice public health. That's the main problem. But the barrier to this is their ignorance. They're unaware. They are not educated. That's the main challenge. Like we have to overcome. And they have got some superstitions, some taboos. Their culture is different. Like they think that some rumors, you can say.
Right, and you think to have like different or unfamiliar terms in the time of COVID-19, for example, like social distancing is a new term as unfamiliar
Yes.
for all of us.
And
Do you
also
think it also contributed to the way that rural areas are much more or less vulnerable in terms of facing COVID?
Yes, you are right.
Okay, perhaps you want to explore on that matter. What do you think? Do you have any suggestion for the policymakers in terms of making these new terms and words so that it's easier for the rural
Yes,
to understand?
I told in my presentation that social distancing is called like social. It doesn't mean physical. So if we can replace the term with physical distancing, that's more appropriate, and they will understand better in that way. Physical distance, or you stay away from another person 6 feet. You maintain the distance 6 feet from another person. If you can explain to them instead of using the term, because quarantine, isolation, these are new terms. These are all we know because we are doctors and public health specialists, but general people, these are new term for them, right? So they don't understand this new term unless you explain to them, or you give them a better, like simpler version of them, a simpler, more understandable version.
Thank you, ma'am. Just for information, in Indonesia, we've changed it a couple times from social distancing to physical distancing. Now it's new normal. So one of the most trouble that we always heard from the society is we are very confused on the terms that the government try to communicate through their policy. So I hope through this conference, the point is how could we maintain ourselves from doing activities that is not important and still have a proper health protocols to be able to save lives. Thank you. Now we're going to the next question for Dr. Dulos. Can you hear me, Dr. Dulos?
I'm here.
Okay. Hi. Okay. I would like to ask a question here in a chat box. You can also see the question, for the first, second, third, and fourth. So, perhaps in the specifically in rural areas, right? How to encourage? The question is how to encourage people living in rural areas who don't get involved in some fields of government programs, such as building local businesses. Perhaps it's also related to the question of when people cannot go out, they always stay at home. What would you suggest for them, especially family from low and middle income family who do not accept these kind of government support? For example, there are some of the society coming from low and middle income family who are untouchable to the government's government's help in terms of money. what would you suggest to these people coming from low and middle income families to still survive even though they have less help?
I believe that what is really need now of the people is that assurance. It has something to do with the heart, not anymore with the mind. Because heart would complement everything a human being can do. A little of assurance from our local leaders would do a lot of wonders in the lives of our rural dwellers. I always believe that attitude matters most. How we behave to a certain situation is very important. Now, getting involved in any government organization or any government projects is really a very, very welcome insight to our rural dwellers. But as a rural development worker, I feel, because I was once also a community worker, I feel that the heart matters most than the mind. Now, in the community, there are a lot of opportunities. There are a lot of assets. It's only a matter of trying to live with the people. When we speak of live with the people, it's not necessarily being physically live with them, but how to get themselves with you. No? If I may adopt the philosophy or the credo of rural reconstruction, it says that go to the people, live among them, learn from them, plan with them, work with them, start with what they have, build on what they have, learn by doing, teach by showing. So we will not give them everything that they need, but we really have to teach them how. It's like a Chinese philosophy that do not give them always fish. You teach them how to fish. That is making them more sufficient, more sustainable, and self-sustaining. Self-sustaining. So at this point in time, what can we do is give them the necessary support from our local government. Let's try to help them, especially in establishing micro business, small businesses, and they have to start from their community. The community is very rich in natural resources. It is where life begins. It's only a matter of giving them the necessary empowerment. When we speak of empowerment, you try a gradual educating them, trying to explore in their environment, because that is where the source of living is. And of course, with the full support of the government, giving a policy to the making a policy for them to become more resilient and to become self-sustaining. I think that's all.
Thank you very much, Dr. Dulos. Now, moving on to Jim. We have few questions for you here. Can you hear me? Hi, Jim.
Yes.
Okay, so this is the question. I forgot to mention the names on previous questions. The question here is coming from Rini Daud from UBM Gorontalo. Can teachers design the learning assessment in the platform you shared? That's the first one. And then the other question is how the flipped learning can accommodate the learner's needs in every subject that they're learning.
Yes, you can incorporate tasks or tests within the platform, and excuse me, it does apply to any subject. The idea is for the teacher to have all the material online so that the students have access to it 24/7, 365. This is the priority, that the students can do their learning when they are most in the mood for learning, because then it is more effective.
Right. Perhaps the next question, how do you make, because this is probably like majority of people coming from few countries always say that That's why we need to have like a teacher authority in the class, because they're not sure that the students will learn. With the question of how do you make sure that they are not being lazy and not doing their work if all the materials are given like outside of the class, and how do you make sure that they're doing their job?
This is the question I'm always asked, that what about the students that do not do their homework? Surely they will not do the preparation for the flipped learning. But my question back is, what about the child that doesn't eat his or her vegetables? Surely they will not eat the bar of chocolate. Well, of course they will, because it is more pleasant. And it's the same here. A lot of students that do not do their conventional homework, it's because they often get stuck with it. They cannot ask the parents because the parents are not specialists, so they lose enthusiasm. Whereas what they are now doing at home is watching videos, looking at resources which they can manage. And very often I will get a student say, "Oh, that video you told me to watch, sir, I found what I thought was a better one. Can you add that to our resource bank?" Which, if it's appropriate, I will do. And again, this encourages the students by saying, "Oh yes, that's my video. I'm now contributing to the class's learning." And it's this frame of mind in making the students contributors to their own learning.
Right. Thank you very much. I think that's a clear answer about how flipped learning direction goes. So basically, we need to change the way that we teach. Some of the teacher consider freedom of students is only unlimited. Only in class the students will have time to put the questions in the proper time. So, but some teachers is also adapting new, more modernized way of teaching, or more freedom for students. I think the way of processing these teaching materials, because I myself is a lecturer as well, so I think the work that you did in flipped learning and also pioneering the cloud computing is what makes the education technology is more attractive to many people right now. So people are now learning and pushing themselves to learn how to use digital or technology in terms of education, how to store their materials online. These things are getting more and more realistic day by day. Okay, so now we will have the video question. Kita akan buka sesi video. Bapak Ibu tolong kolom chatnya hanya digunakan untuk pertanyaannya saja ya. Nanti untuk yang lainnya bisa saya akan buka kolom pertanyaan tapi untuk bertanya saja ya. Kalau ada di luar dari pertanyaan bisa ditanyakan secara japri kepada prodi masing-masing. Oke, sekarang kita baik Bapak Ibu yang ingin bertanya, pertanyaannya bisa raise hand. Kalau ingin bertanya video bisa raise hand ya. I just saw like 2 people raised hand. I'm afraid that Bapak Ibu nggak apa-apa ya, bisa dalam bahasa Indonesia. Nanti akan dicoba untuk translate kalau memang mau untuk coba untuk bertanya secara video. Since I thought that there's no more question in terms of video. There's one question from our dear senior expert. So we will give the time for Dr. Dolf Effenberg from Netherlands. Yes, sir. Do you have any question, please?
Okay. Good morning, everyone, or well, it's good afternoon, of course. Assalamu alaikum. I would like to have a question to Professor Ab Osterhaus about the vaccine efficacy. at what vaccine efficacy should be, at what level, to get out of this new normal situation, and what does he expect, how long it will take before we are arrived at that point?
Okay,
Yes.
Professor Osterhaus, you can directly answer the question. Okay, Professor Osterhaus, are you here? Okay.
Okay, I'm muted now. Thank you. So the question is about the percentage of people that should be protected after vaccination. So what is the efficacy or perhaps the effectiveness of the vaccine? What's the minimal effectiveness that we should have to get out of this crisis? And the second question was, how long is it going to take that we are there? Well, answer to the first question is related to the R0 of the virus. That means how fast is the virus spreading in the community? What level of immunity should you have in the population? And the general thought is that if you have a vaccine that is effective for this virus, would be effective for about 70% at least, then 70% would be let's say, the lowest level for which you can go if you would like to get it under control, provided indeed people are using the vaccine. So let's say this 70% is not sacred, of course, but it is a ballpark figure. And if you then ask me, when is the vaccine going to be available? I think it's a little bit difficult to say. If everything goes well, I think we will have a vaccine that can be distributed to people at risk. It will be before, let's say, the next summertime. It could be distributed if everything goes well. I should say, however, immediately, if we look at the total production capacity to date, then we will have, let's say, we are talking for that period by the end of 2021, that we could have produced some billions of vaccines with the current technology. One of the big issues is, of course, how are we going to make sure that we have an equitable distribution of the vaccine also to those people in countries where there's no vaccine production, in countries that really need it, in terms of being able to vaccinate their people at the highest risk. I think there are a number of activities ongoing by WHO, Gavi, CEPI, international organizations that currently are working on that, on equitable distribution. I think if we look back at the last pandemic that we had, the influenza pandemic, if you look at how vaccines were being used at that time, I'm afraid that was not very satisfactory. There were a few countries in the world that had a lot of vaccine, whereas most of the countries in the world had nothing. So I think that what we need to do is to have a system, and these systems are going to be in place. In Europe, we are talking about it, but also in WHO circles. And I mentioned Gavi and CEPI. They are working on a plan to really make it possible to distribute the vaccine also to countries that could in fact not afford it from the very beginning. So I think we have a major responsibility there. So I think to summarize my answer, so the availability of the vaccine will, as far as I think, will not be before, let's say, the first month of the next year, until the summertime. Then we can gear up to start vaccinating people. There will not be enough vaccine for the world. And I showed one slide where I showed that, for instance, the Serum Institute India speculates that it will take till 2024 before we have enough vaccine for the world at large. So the situation is, on the one hand, there is hope. If everything goes well, and there are not too many side effects or adverse effects of the vaccines, we will have it. We can start vaccinating beginning of next year till the summertime of the risk groups. And I should mention also the healthcare workers. But I think that is an optimistic view. We don't know. And I should say immediately, the vaccine is not, or the vaccines are not the only solution to it. I think we will be stuck with the measures that we are taking today, this physical distancing, as we heard, and all the other measures that have to be taken. But I'm rather optimistic there that vaccines will become available, and it will really be our task to increase the acceptance in the population at large on the one hand, and to gear up for the production that we will be able to distribute the vaccine in an equitable way worldwide. Over.
Okay, thank you very much for your answer to the question.
You're welcome.
Okay, thank you very much, Professor Osterhaus and Dr. Dahl, for asking a great question. I'm afraid that right now we have to move forward to the next agenda of closing ceremony, since we have a very tight schedule here in Indonesia. It's already 5 p.m. Already. It's 5 p.m. and 12 minutes. So we plan to end the conference at 5:30, so hopefully it will be on schedule. We would like to thank you for all the professors that have joined us today. It's a great thing to know that there are lots of innovation happening in different sectors. Before we're going to close, if I may ask each of the speakers to give perhaps 1 or 2 words you want to say about the conference, because it's now recording, and then we have also stream it through YouTube, and also it will be up in the local news for today and also for tomorrow. So I will give the time for each speaker to say things about the conference and about the topic of innovation and also research during the pandemic. I will start from Professor Nauzia. Please, do you have any closing remarks?
Closing.
Hello, ma'am? Okay. Okay, now, because I think, okay, can we go to Dr. Doulos, please? Oh, okay, Professor, yeah. Professor Nauzia, do you have any closing, brief closing remarks to up the spirit before we close the session? You still in mute mode? Okay, you're eating, right? Okay, that's fine. That's so we will. Thank you very much for your participation.
Okay. I just wanted you to unmute me. It's okay.
Oh,
I can speak.
Yes.
It was really a pleasure for me, because I'm really happy that you have arranged this seminar every year on diverse issues on the SDGs, and you cover a lot of things. You covered 5 things in this seminar, and I'm really happy to be a part of it. Thank you very much for inviting me. And I have learned a lot from other speakers as well. And I think we will continue to learn from each other in future. So best of luck, everyone. Stay safe and stay well. I'm really happy to be here with you. Thank you very much.
Thank you very much. Please stay still, because after this we will have the awarding certificate. We will have the awarding certificate right away after this. Okay. Next. Next is Jim Big. Sorry, Dr. Doulos, please. Do you have any closing remarks?
Yeah, I am really very grateful for giving me this opportunity to be a part of this very important occasion. And it's really a very, very great learning experience. I didn't only share, but I learned a lot from the different speakers. And it's really great. No? I got some notes, very important notes, and for sure I will be sharing this with my students. Thank you to the organizers. Congratulations. And it's really high commendable. Now, I hope that this will not be the 3rd, but there is a lot more, 4th, 5th, 10th, up to, so that you can cover a lot of fields, a lot of interests that would suit really the needs of our population in all sectors of the globe. Thank you, and more power to the organizers. And thank you, Dr. Ayo, for inviting me. God bless
Thank you very
everyone.
much.
Keep safe
Yes.
always. Thank you.
Thank you. Next, we would like to hear from Dr. Keng Tung Woo. Are you still here?
Yes.
Yes.
Thank you for inviting me to this very nice conference. I hope my technology, I can bring it to the Indonesia and then to help the people who stay in the rural area. So I see you next time, and to the all, have a nice evening. Thank you very much.
Yes. Thank you very much. Next on, Jim, do you want to say something?
Yes, I think this pandemic has brought to a head the need for this online cooperation between as many people as possible. And I'd like to thank you very much for giving me this opportunity to share my ideas with so many wonderful people. Thank you.
Okay, next on, would like to hear from last one, but not least, Professor Osterhaus. Do you want to say something?
Yeah, I would like to thank you very much for being part of this this meeting. I think it's very good to have this virtual possibility indeed to communicate. It saves a lot of traveling. It's not a substitute to do real meetings, face-to-face meetings, but I think it serves a purpose. And I am very grateful to be able to share my ideas, as the others said. And I think in the pandemic, we all have to work together. So I think it's very important that we organize this kind of thing. So I congratulate you with a very nice initiative. Thank you.
Thank you very much. On behalf of all the organizer, we also would like to say thank you. And for that, we will have the awarding certificate right after this. So, Bapak Ibu, sekarang kita akan masuk kepada closing ceremony yang akan dipandu kembali oleh MC. This is the end of our international seminar, specifically provide information about these 5 different topics and bringing forward reputable, notable scholars and professionals coming from across the world, literally coming from many countries. So by this, as the moderator of this session, my name is Ayu. I would like to say thank you very much. I will give the floor over to the Master of Ceremony.
Baik, demikianlah plenary session yang merupakan inti dari IIC SDGs tahun ini. Semoga materi dan ilmu yang telah disampaikan oleh para speakers dapat menjadi insight bagi kita untuk terus aktif dalam program pembangunan berkelanjutan di negara kita, Republik Indonesia, khususnya di Provinsi Gorontalo.
Benar sekali Fauzia ya. Dan tadi juga menghadapi pandemi yang terjadi tahun-tahun akan mendatang dan tetap melangkah terbaik dan presenter terbaik.
Baik, sebelum
ya, baik kami ulangi. Ya, Fauzia dan hadirin peserta webinar, selanjutnya kita akan melangkah pada acara pemberian sertifikat penghargaan untuk pemateri dan kepada pakar atau expert kita pada hari ini, dan dilanjutkan dengan pemberian materi kepada artikel terbaik ya, ada 2 kategori ya. Tadi di awal sudah dikatakan ada artikel terbaik dan juga presenter terbaik yang diselenggarakan tadi pagi di oral proceeding atau presentation.
Okay, we would like to invite Ms. Ayu Anastasia Rahman MA on behalf of the conference team to deliver the certificate. Ms. Ayu, the floor is yours.
Okay. Okay, back to me. Thank you very much, Master of Ceremony. By this, I would like to give a certificate of recognition. Also, millions of, we are very grateful to host such amazing speakers here. By this, probably we can display the certificate kepada Bapak IT. Barangkali bisa menampilkan sertifikat. Yang pertama akan diserahkan kepada Okay, the first one, the certificate of recognition on behalf of the leaders of four institutions that is holding this conference. We would like to say thank you very much for Professor Nazia Yasmin, PhD from University of Bangladesh, that served as a speaker in the third International Interdisciplinary Conference on Sustainable Development Goals with the theme Innovation to Empower Rural in the Time of COVID-19. Next, we would like to say thank you very much for Dr. Keng Tung-woo, PhD, bioenergy researcher and professor from National Chongqing University, also as a speaker for today's conference at the third International Interdisciplinary Conference on Sustainable Development Goals. Next, we will also to congratulate and also thank Dr. Christita Doulos, the PhD in Rural Development and also a professor in Pangasinan State Universities. Hope we can collaborate more because as the neighboring countries, of course, we will have much more things to talk about. And also,
yeah,
next,
I would be glad to. Yeah.
Yes.
In the graduate school, we are willing to cooperate with you.
Yes, that's great. Thank you very much.
Okay.
Next, would like to also congratulate for Jim Baker. Obviously, Jim has a long achievements and recognitions. However, this small of recognition coming from our institutions hopefully will give you a spirit to be a great educator as you are already. Also, we would like to say thank you very much for joining us as a speaker at the third International Interdisciplinary Conference on SDGs. At the last one, we would like to say thank you to Professor Dr. Albert Osterhaus, virologist and also member of WHO Advisory Board, to have such an amazing discussion across these disciplines as the committee and the conference teams. I would like to say thank you very much for all the speakers. Also, we are looking forward for any cooperation that we can do together in the future, obviously involving large number of our students and rural communities and governments, because the conference is actually bridging the discussion between all of these people coming from different backgrounds. So you can just contact me and we will see what we're going to do together. Thank you very much once again for all the speakers for joining us until the end of this session. I will give the floor back to Master of Ceremony.
Baik, terima kasih Miss Ayu Anastasia Rahman MA ya, yang telah memberikan sertifikat penghargaan kepada pemateri internasional kita pada hari ini. Dan selanjutnya Fauzia, kita akan menginformasikan bahwa panitia akan memberikan link absensi kehadiran kepada seluruh peserta webinar di chat box Zoom.
Baik, ladies and gentlemen, the committee will share the link for the attendance links on the Zoom chat box and you can start fill it.
Iya, jadi seluruh peserta webinar sudah bisa mengisi link absensi di chat box Zoom. Dan nantinya dengan mengisi link, seluruh peserta akan mendapatkan sertifikat ya sebagai peserta dan akan dibagikan oleh panitia dalam waktu 1 minggu setelah pelaksanaan webinar berlangsung. Ya, panitia sudah share ya untuk linknya ya. Oke, dan kita akan lanjutkan lagi. Oke, untuk awarding certificate ya, untuk sesi kedua, Fauzia, kita akan melangkah pada pemberian sertifikat penghargaan kepada para pakar atau expert kita.
Okay, so for the next session is certificate awarding for our expert today. Dan untuk pakar yang pertama, hadirin sekalian, diserahkan kepada Profesor Dr. Haja Maimun Ibrahim SKMM, akan diserahkan oleh Rektor Universitas Bina Mandiri Gorontalo, Dr. Haja Titin Dunggio, MSI MKes. Kepada Ibu, dipersilahkan.
Terima kasih.
seluruh sivitas akademika Universitas Bina Mandiri Gorontalo dan pelaksana ya Bina Taruna Gorontalo, kita Bina Taruna Gorontalo dan kita Taruna Gorontalo sebagai kolaborasi mengucapkan terima kasih banyak kepada Profesor Dr. Haji Maimun Ibrahim SDGs telah melakukan pendampingan sebagai expert pada oral presentasi. Ucapan terima kasih dari kami dan tentunya pada kesempatan ini berbentuk penghargaan, berbentuk sertifikat untuk Profesor Dr. Haji.
Ya, Ibu Titin.
Ya. Bisa kedengaran?
Ya. Suaranya kecil, Bu.
Oh, ya. Baik. Tidak kedengarannya.
Iya, Bu. Mungkin bisa diulangi.
Ya, baik. Ya, Sivitas Akademika Universitas Bina Mandiri Gorontalo beserta Setia Bina Taruna Gorontalo, Sitek Bina Taruna Gorontalo dan program pasca sarjana Setia Bina Taruna Gorontalo mengucapkan terima kasih banyak kepada para narasumber, para partisipan, presenter, kemudian juga dari pimpinan perguruan tinggi ataupun mewakili dari pejabat pemerintahan, dan teristimewa juga pada panitia pelaksana. Alhamdulillah kegiatan seminar pada hari ini bisa dapat berjalan dengan lancar, dan teristimewa juga ucapan terima kasih kepada Ibu Prof. Dr. Haji Maimun Ibrahim SMM yang tadi telah melakukan pendampingan sebagai expert pada oral presentasi. Sekali lagi ucapan terima kasih untuk itu. Baik, itu saja barangkali cukup.
Iya, baik, terima kasih kami ucapkan kepada Ibu Dr. Hajati Tidunggio MSc MKes, dan selanjutnya kita ke pakar yang kedua, Julfi Ayu Sapium MSI, akan diserahkan langsung oleh Ketua Setia Bina Taruna Gorontalo, Ibu Dr. Lisda Van Gobel MPA, disilakan.
Ya, baik, terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Pertama kami mengucapkan terima kasih banyak kepada seluruh pakar ataupun expert yang telah melaksanakan pendampingan sejak tadi pagi, dan seluruh partisipan yang telah mengikuti webinar internasional sejak tadi siang sampai dengan sekarang. Terima kasih banyak. Dan atas nama lembaga, ya, saya mengucapkan terima kasih kepada Ibu Julfi Ayu Sapium MSI yang telah berkenan menjadi expert dalam kegiatan internasional kami, sebagai bentuk rasa bangga dan apresiasi kami bahwa kami akan menyerahkan sertifikat penghargaan ini kepada Ibu Julfi Ayu Sapium MSI. Karena telah bersedia sharing keilmuan, Bu. Terima kasih banyak kepada peserta presenter juga, dan alhamdulillah telah berjalan lancar sejak tadi pagi. Demikian, terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih kembali, Bu. Ya, selanjutnya ada siapa, Bu Fauzia?
Professor Nauzia Yasmin from University of Bangladesh was delivered by Director of Master Program of Setia Bina Taruna Gorontalo, Professor Dr. Arifin Tahir, MSc.
Iya. Untuk Bapak Profesor Dr. Arifin Tahir, bisa dengar suara kami, Pak? Ya, sambil menunggu ya, kita ke pakar yang keempat dulu ya, sambil menunggu Bapak Prof. Arifin. Ke pakar yang keempat ada Bapak Dr. Haji Anis Naki, MM, akan diserahkan langsung oleh Ketua Stitek Bina Taruna Gorontalo, Bapak Dr. Insinyur Haji Ajis Rahman, MM.
Baik, terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Selamat sore. Saya atas nama pimpinan dan Sivitas Stitek Bina Taruna Gorontalo ingin menyerahkan penghargaan kepada pendamping atau expert Bapak Dr. Haji Anis Naki MM yang telah memberikan pendampingan sejak tadi pagi mungkin sampai sore hari ini. Untuk itu atas nama lembaga saya memberikan penghargaan dalam bentuk sertifikat. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Ya, waalaikumsalam warahmatullahi wabarakatuh. Terima kasih ya kepada Bapak Dr. Ajis. Dan selanjutnya Fauzia, kita akan melangkah pada sesi ketiga untuk penganugerahan sertifikat kepada dua kategori, ada Best Paper dan Best Presenter, yang akan diserahkan langsung oleh Bapak Sudarsono MSI selaku Kepala LP2M Universitas Bina Mandiri Gorontalo.
We would like to invite Mr. Sudarsono MSI on behalf of the proceeding team to deliver the certificate. Mr. Ono, the floor is yours.
Ya, kepada Bapak Sudarsono, mohon informasinya bisa mendengar suara kami. Ya, sekali lagi kepada Bapak Sudarsono. Ya, kita masih menunggu ya untuk terhubung dengan Bapak Sudarsono, di mana tadi sudah dilakukan penilaian ya untuk oral presentation dari tadi pagi. Oke, sudah terhubung dengan Bapak Sudarsono ya.
Oke, baik.
Ya. Ya, baik, silakan Pak.
Oke, kedengaran?
Iya.
Baik, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah, kami apresiasi teman-teman autor yang telah berproses, telah submit artikelnya, sehingga di sini kami tentukan 5 nominasi dan akhirnya 1 paper terbaik. Dari 5 nominasi tersebut di sini saya akan sebutkan satu-satu. Yang pertama ini ada artikel yang berjudul Economic Shift and Inequality Between Province in Sulawesi Island, Republic of Indonesia. Yang kedua ada The Influence of Online Marketing Strategy on MSME Sales in Medan City during Pandemic COVID-19. Artikel yang ketiga terkait Identification of Economy Subsector that can increase among COVID-19. Artikel yang keempat yaitu Gastronomic Tourism Development in Gorontalo Province. Dan artikel terakhir yaitu The Innovative Design of Homestay to Address COVID Protocol. Dari kelima artikel yang masuk ini yang merupakan artikel terbaik dari artikel yang kami terima. Dan untuk artikel terbaik untuk best paper yaitu artikel The Innovative Design of Homestay to Address COVID Protocol yang ditulis oleh Dr. Idewa Gede Agung Biasana Putra STMM dari Universitas Udayana Bali. Demikian untuk best paper. Bisa ditayangkan sertifikatnya. Ini untuk best paper. Selanjutnya untuk best presenter. Untuk best presenter ini kami setiap room itu ada 2 presenter terbaik, yaitu yang pertama di room Otanaha ada Yuni Susilowati SPD MPD dari Stikes Yatsi Tangerang, yang kedua Emdat Supriyatno Eskep Nurse Mkep dari Universitas Wiraraja Sumeneb Madura. Untuk di room Saronde juga ada 2, yaitu yang pertama Dimas Hastamanugraha ST Master Engineering, terus yang kedua adalah Yuman Rayanoho SPD MSc. Untuk di ruang Tomini ada 2 juga, yaitu Sugeng Eko Yuli Waluyo SMM dan Dr. Bambang Dewi Suseno MM. Untuk di ruang Karawa ada 2, yaitu Samsul Hidayat SMM dan Muhammad Faisal SE MSA AK. Dari ke-6 nominator ini yang menjadi best presenter yaitu atas nama Dimas Hastamanugraha ST Master Engineering dari Puslitbang Kebijakan dan Penerapan Teknologi Kementerian PUPR Republik Indonesia. Demikian sertifikat ini, harapan kami teman-teman presenter dan author tetap berkolaborasi dengan kami selanjutnya di konferensi internasional yang keempat. Demikian, terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Ya, kami ucapkan selamat ya kepada penerima sertifikat penghargaan untuk Best Paper dan juga Best Presenter. Oke, Fauzia dan hadirin peserta webinar yang kami hormati, dengan berakhirnya pemberian sertifikat maka berakhir pula seluruh rangkaian acara webinar internasional hari ini dan kita akan masuk pada acara penutup.
Yes. Ladies and gentlemen, now that we have completed today's event, we will close the webinar. Alhamdulillah ya Fauzi, hari ini kita telah berhasil melaksanakan webinar internasional walaupun di tengah pandemi COVID-19.
Benar sekali ya. Dan tak lupa juga kita mengucapkan terima kasih ya yang sebesar-besarnya kepada tamu kehormatan, kepada pemateri, expert, dan kepada seluruh peserta yang telah mengikuti acara ini sampai dengan selesai.
Thank you for all the honorable guests, speakers, and all the participants who have attended these events until the end. Hopefully, this event will bring the insight for the future development of Indonesia, especially during this pandemic of COVID-19.
Benar sekali Fauzia ya. Semoga harapan kami acara ini nantinya akan memberikan pencerahan dan juga wawasan kepada kita semua, tentunya untuk pembangunan Indonesia ke depan, khususnya di masa pandemi seperti ini. Ya, dan terakhir kami ucapkan terima kasih kepada seluruh sponsorship ya atau pendukung dari acara pada hari ini webinar internasional kita yang kali ketiga ya atau tahun ketiga, kepada pemerintah Provinsi Gorontalo
dan kepada Aptisi Gorontalo,
ada AP Vokasi Gorontalo,
lalu ada Academic International Consortium of Indonesia,
ada TIE UPS International,
dan yang terakhir ada PUIM Netherlands Senior Expert.
Oke, Fauzia, sayang banget ya. Kita harus berpisah ya. Saatnya kita akan berpisah dengan seluruh peserta webinar internasional pada hari ini. Ya, dan mari sama-sama kita tutup acara pada sore hari ini dengan melafazkan hamdalah. Alhamdulillahirabbil alamin.
Finally, saya Fauzia
dan saya Fauzi sebagai Mas
Green